Hi everyone and welcome to this series of INI CET previous year questions. A very good evening to all of you, those who have joined. Those who have joined, please drop a hi, hello, good evening in the chat box so that I know that you've joined us. I hope I'm live and all of you can see me. So this series is basically to discuss the previous year questions which have been asked in INI CET, and I have come with the last 5 years. I have tried to accumulate the last 5-year questions, and those who were repeats, then it's already been covered, then they will not be repeatedly discussed. Just that the important topics should not get missed. That's the purpose of this lecture, right? So just so that you may understand, if you are able to crack the code of the questions, if you are able to crack how the language of the question is, because we all read a lot, most of you must have read so many things, but finally in exam, when you have to read through all of the questions and then come to diagnosis or whatever an answer, that is the time that we fall short. So let's begin with the first question, that is match the following. So it is patch test, KOH mount biopsy and slit skin smear. You're most welcome to write your answers in the chat box as and when we go, and if you have any doubts you may write in the chat box. So as and when we go, I'm going to take up those questions, right? So patch test, I understand that it is a test we do on the skin for any kind of allergic reactions. So okay, it looks to me like it should be contact dermatitis, but then lupus and leprosy are also skin conditions they're talking about. So let's look at the other one, KOH mount. So it must be some kind of fungal infection that they want to see, some kind of hyphae. Which out of these do you think is a fungal infection? The only one over here which is a fungal infection is tinea. So tinea is caused by dermatophytes. So dermatophytosis is tinea. Then you also have tinea versicolor or tinea nigra. Tinea versicolor caused by Malassezia furfur, tinea nigra caused by Hortia wernickeyi. I understand that KOH mount should be applicable to tinea. Biopsy, leprosy or lupus vulgaris. Okay, let's look. And the slit skin smear, we all understand that the slit skin we take from the ears, earlobes, and the 6 places, which is the forehead, cheek, nose, earlobes, buttocks, and also the nasal secretions which are collected. What are they collected for? They are all collected for leprosy. So I know that patch test is for contact dermatitis. So of course biopsy remains for lupus. So it is 1C. Okay, then this is the only option which has 1C, so that goes there. 2D, 3B and 4A. Quite simple. Okay, so by elimination you could have been able to solve this. Then virus and nucleic acid types. This is a very favorite question, especially for INICET. And of course we know our mnemonic. We know our mnemonic of the DNA viruses. It is happy with a double H. How do we write? We write happy, Y above, because Y looks like 4. So we know that there are the 4 P's. We have the herpes viridae, so human herpes viridae. So all the human herpes viruses 1 to 8, HHV 1 to 8 are going to be your DNA viruses, right? Then you have hepadna. Hepadna, we know partial DNA virus. What is it? It is the Hep B, hepatitis B, the only hepatitis virus which is a DNA virus. Then adeno, parvo, papoviridae, which includes your human papilloma virus. Then the pox viruses and the phages, the bacteriophages. Okay, the bacteriophages. So of course bacteriophages are not going to cause any disease in the humans, right? So what are my options? Okay, I see rotavirus here. Then I need to remember that rotavirus, we always say that this is rota hua virus. Why is it always crying? It is the rotating wheel, but it is also rota hua. Why is it always crying? क्यों रो रहा है ये? क्योंकि इसके साथ क्या हुआ है? धोखा. What is धोखा? Dhokha means double-stranded RNA. It's a R for rota, R for RNA, but it's a double-stranded RNA. That's the dhokha which it got. And when you get dhokha, your heart breaks into segments, many segments. So it has a segmented RNA. Segmented RNA genome it has. And what else? No one gave him the blanket. The envelope or the blanket is borrowed by the virus from the host. Now, no host has given him the blanket, so he's alone and crying bichara. So, it is also non-enveloped. We always understand this about rotavirus. So, if I look here, rotavirus has to be my double-stranded RNA virus. What about SARS-CoV? It is the simplest ever, very, very common single-stranded RNA. Parvovirus. So, we say that all of these are double-stranded DNA viruses. Parvo तो single-stranded है. Yes, so only and only parvovirus is single-stranded DNA, and it is also non-enveloped. It is also smallest, right? So parvovirus is an exception in all of these. Which are non-enveloped? DNA viruses का PAP क्या था? PAP, PAP. These are all non-enveloped amongst these, right? Fine. So parvovirus becomes your single-stranded DNA virus, and human papilloma, just like this mnemonic, is your double-stranded DNA virus. Very, very simple to understand. So 1B, 2A. Where is 1B, 1B? 2A is this one. So 3D and 4C. So option B becomes my correct option in this, right? Okay. A few answers in the chat box and interaction would be nice, so that I know that you already understand what I am talking about. Since these are only previous year questions, most of you must have come across them somewhere or the other. It is just a one go. In one go, we are going to revise all of them so that we get into the zone. We are of course going to have a marathon in which we are going to discuss deeply all of the topics, so that we are much prepared for the final INI CET exam, because as is very, very famous already, that INI is famous or infamous for repeats. Always repeats, previous year repeats. So select the correct statement regarding the organism. What is this? This is negative staining, the negative India ink staining, and we all know that this refractile halos and the yeast cells inside, this is always the crypto. Crypto means hidden, right? Crypto means hidden. So it is hidden beneath a capsule. So Cryptococcus because it is a round fungus. It is round fungus with narrow based budding and hidden inside a capsule. That is Cryptococcus. They are saying humans are the only reservoir. Does it look like a good option to you? No. How are they spread? Pigeon droppings. Right? Pigeon droppings is the source of cryptococcal infection. So how can humans be the only reservoir? This is a wrong statement. Patient is at high risk with CD4 less than 900. That's a huge number. So if they had written less than 200, then I would have agreed with them. Lung is the primary site of infection. Looks like correct to me, because pigeon droppings and inhalational route is how we get cryptococcus. Now, cryptococcus is known to cause meningitis, but the primary site is the site of inoculation or infection. So we are going to breathe in the yeasts. So the primary site is going to be the lung, and then from the lung they are going to disseminate into the CNS, causing meningitis. So this looks like a correct answer. Pseudohyphae and budding. Pseudohyphae is shown by whom? Candida. While budding is correct, pseudohyphae is not correct, because pseudohyphae is shown by Candida. So option C becomes my correct option for the question. Okay, fair and simple. A pregnant woman presents with a history of painful genital ulcers during pregnancy. Her newborn also has similar ulcers. Okay, so they are also talking about neonatal genital ulcers now. Examination of the smear reveals presence of Zank cells. What is the likely diagnosis? Now, if you look, obviously HPV is out of question, because they are talking about painful vesicular lesions, and human papilloma virus leads to genital warts. Klebsiella is obviously out of question. It's simply a gram-negative bacterium. Most common cause of community-acquired pneumonia. What about these two? Now, both of these can show Zank cells. The Zank smear morphology of varicella zoster and herpes simplex is non-discriminatory. They are both the same cells are shown. So what is important here is the history. Painful genital ulcers. What would have happened in VZV? VZV is chickenpox, right? So chickenpox would have led to disseminated kind of lesions or rashes all over the body starting from the trunk, but specifically in the genital area. And of course HSV2 is written. So we know that below the waist is HSV2, above the waist is HSV1. So HSV2 becomes my option over here. Okay, so based on Zank smear I could not rule out VZV, but based on the history I could rule out varicella zoster virus. Next, 28-year-old patient presents with fever, fatigue, retroorbital pain. Of course, we are talking about dengue. Now they are saying after 5 days. So these are the buzzwords, these are the catch phrases in your sentences that you have to take care of, suggestive of dengue hemorrhagic fever. Now they have given a specific term to you. Which investigation is appropriate for confirmation? Do you think NS1 antigen is any longer sensitive? I believe that if it was day 1 to 4 or even till 5, before the 5th day, it would have been a good investigation, right? Viral culture, who is going to do viral culture now? Nobody does viral culture. Even the most research laboratories, they barely do these viral cultures, right? Circulating IgM and IgM ELISA. I believe that the investigation that they are asking, yes, correct, Arshad, the best correct answer is going to be IgM ELISA. Circulation, the IgM is going to come into circulation in the 2nd week of illness. Right. So after 7 days, if they had written, I could have said circulating IgM. Anyways, the investigation is going to be ELISA only, in which we are going to detect the IgM. So the best appropriate answer is going to be D, which is IgM ELISA. We will discuss dengue hemorrhagic fever and shock syndrome. I have one more question related to dengue where we talk about the warning signs. So in that, in just a little bit, we will discuss the differences between mild dengue, dengue with warning signs, and dengue with severe dengue, because they give you this clinical scenario and they expect you to know the difference between dengue fever, DHF and DSS, which is the shock syndrome, right? Great. Myocarditis is common complication of faucial diphtheria. You understand what is faucial diphtheria? It is simply diphtheria. Faucial means in the tonsils. So the pseudomembranous tonsillitis, the pharyngitis which is caused by Corynebacterium diphtheriae. Corynebacterium diphtheriae. Assertion, okay, it is a complication, okay, I understand it is. It is due to bacteremia by diphtheria. This does not look okay to me. We all understand that the mechanism of action of diphtheria is, Corynebacterium diphtheria is toxemia, toxemia. It produces the diphtheria toxin, the DT toxin. Who can write in the chat box the mechanism of action of diphtheria toxin? How does diphtheria toxin work? If you can write in the chat box, it's good. Otherwise, I have another question coming up for you where you all have to mark about the diphtheria toxin. So, it is basically inhibition of elongation factor 2 leading to inhibition of protein synthesis. So, toxemia is the reason. It is going to sit in the pharynx. It is going to release the toxin. The toxin is going to, yes, ADP ribosylation of elongation factor 2. Correct, Arshad, right? So, I believe assertion is true, but reason is false and also not the explanation. So, I think my option B is the correct answer here. Sorry, option C is the correct answer here, where assertion is true, but reason is false, right? Okay. Which of the following parasites demonstrates parthenogenesis? What is the meaning of parthenogenesis? That the female is able to reproduce asexually. Female reproduces asexually. That means she does not need the male in order to lay the progeny or the larval stages. We know only one such parasite, that is Strongyloid stercoralis. What does Trichuris lay? Trichuris lays eggs. Enterobius vermicularis, the eggs of course. Ankylostoma, which is the hookworm, eggs. So, all of them we see the eggs. Faucial diphtheria may common. Yes, bullneck is going to be common, that's true. That is just a sign and symptom of the faucial diphtheria, right? Okay. So, strongyloids, when we look at the life cycle of Strongyloid stercoralis, we know that it's the smallest nematode and it is also ovoviviparous. What is the meaning of ovoviviparous? That it lays the eggs, but the eggs are laid in the intestine itself. They are not laid outside in the feces. And the moment the eggs are laid, they hatch out and they release the larva. So what we end up seeing in the stool is always the larva of strongyloids. We never ever find the eggs of strongyloids. And also the female, once in the intestine, the female is able to give birth to progeny by itself. You see, there is no male over here. Inside the intestine, the female itself is enough to survive. Two other major important points about strongyloids that it causes is hyperinfection syndrome. It causes the hyperinfection syndrome. Why? Because the larvae which is hatched out in the intestine itself, and the female itself is sitting and producing multiple larvae. So there is lots and lots of progeny production, and lots of infection is there, which becomes widespread, disseminates, goes to different sites of the body. The rhabditiform larva at this stage, the rhabditiform larva which has come out of the eggs, decides to migrate and go to different organs. That is the reason that it also leads to autoinfection. Classically seen with strongyloids is autoinfection and hyperinfection, and ovoviviparous and parthenogenesis. These are all the important terms that you need to know about strongyloids, right? Great. We know that the two types of larva always, the filariform larva is always the infective stage, right? Is always the infective stage, whereas the rhabditiform is always the diagnostic stage. Can you tell me for strongyloids, we are talking about strongyloids only, can you tell me the mode of infection? In strongyloids and hookworm, two important parasites where mode of infection is not ingestion, it is the skin penetration. And who will do this skin penetration? It is the rhabditiform, the filariform larva, which is the infective stage. So how is it causing? So first, infective stage, filariform larva is entering through the skin, it is becoming an adult, leading to parthenogenesis, oviviparogenesis, hyperinfection, autoinfection, everything. Ultimately, the rhabditiform comes out in the stool, and in a free living state, that is in the soil, they convert either into adults, which is male or female. Then they produce eggs, which then releases rhabdiform, which develops into filariform and enters inside us. Okay, this is, so every time rhabditiform will be coming out, rhabditiform will develop into filariform in the soil, in the environment. Alternatively, the rhabditiform can directly convert into filariform. So I can take the long route or short route, does not matter, don't get distracted. Ultimately, what's happening? Rhabditiform is turning into filariform, and filari, F for filari, F for infective, is going to infect us through skin penetration, right? And so these are all the important terms. So skin penetration is mode of infection, not ingestion. For whom all? For ankylostoma, because it is hookworm. Also for Necator americanus, hookworm. For strongyloids, hookworm. Rest all the nematodes, mode of infection, ingestion, right? Okay. Best investigation for identifying malaria species. Now they are saying best investigation. What kind of a question is this now, right? They are saying quantitative Buffy coat. I have spent all my life believing that QBC is done for malaria, QBC is done for malaria. Genes are stained with thin smear, genes are stained with thick smear, acrid in orange stain with thin smear. So this is how they have tried to confuse you. Two options they have given for genes are alternating between thin and thick. Now you will get confused. And one fluorescent staining they have given, acrid in orange with thin smear. Now you will believe that since thin smear gives you a better picture, gives you a better quality picture, and acrid in orange itself will produce fluorescence, so it is very difficult to miss. You will always believe that acrid in orange should be the best investigation, but that is not true. Why? Because acrid in orange is a very, very expensive method, and when you have to do surveillance or diagnosis of malaria, you get loads and loads of samples. Expensive is one thing. Secondly, all of these fluorescent dyes and fluorescent microscopy techniques, they are associated with a lot of false positivity, because you need a trained eye to tell you whether the fluorescing substance that you are seeing Is that the parasite or is that any artifact which had entered inside your slide and you're looking at that? Okay, so very difficult to differentiate between artifacts and those. So false positivity is very, very high. QBC I don't think is the best method, because QBC is very, very skill heavy. It is very cumbersome. First you have to take a capillary, then you have to centrifuge the capillary, coat the capillary with acridine, then again you need a fluorescent microscope. So both of these need fluorescent microscopes, which are expensive equipment. So the easiest, the most sasta sundar tikau methods are the Giemsa stains, the Romanowsky stains. Which stains? You cannot not know the Romanowsky stains for malaria. Please tell me in the chat box which are the stains, especially an Indian stain, you cannot afford to not know the name of. So these Giemsa stains are very, very cheap, okay, and loads of slides can be processed, and all you need is a simple light microscope. Yes, strongyloid shows autoinfection. I have already talked about it. So please tell me the stains, Indian stains used for malaria. Okay. Now the catch is thin smear or thick smear. We know that thick smear is used for survey. Okay. So basically you take a good quantity of blood and you just see whether at all any parasite is present or not. Okay. Since you are taking a higher quantity of blood, highly likely that you will not miss that a parasite is there. Once you have realized that okay, parasite is there, you make a thin smear, which is a long tongue shaped smear, and then you scan the entire slide to see which all stages of malaria are present and which species of Plasmodium is present inside the patient. So actually the best method is the Giemsa stain with the thin smear, because thin smear has more sensitivity and specificity, because even if there are less number of parasites, you are scanning the whole slide, you will be able to detect. But and also specificity, once you see, you can be very, very sure which species of Plasmodium is infecting. So the best answer over here is the thin smear. Since nobody has answered up till now, for identification of malaria, the Indian stain is the Jaswant Singh Bhattacharjee stain, the JSB stain you cannot afford to miss. Which else Giemsa stains? The Leishman stain, the Wright stain, Giemsa stain, JSB stain, these are all Romanowsky stains. These are all Romanowsky stains. Okay. These stains can also be used for microfilaria, elephantiasis. QBC can also be done for microfilaria or elephantiasis. So basically any parasites in the bloodstream, okay, be it malaria, be it the hemoflagellates, which is Leishmania, trypanosoma, or microfilaria such as elephantiasis, they can be visualized using the Giemsa stain. Giemsa stain is done for blood. It can also be done for agents of systemic mycosis, fungus which is there in the blood. So whenever you want to make a diagnosis of agents in the blood, you choose Giemsa stain, okay. An HIV patient presented with watery diarrhea, stool examinations revealed oocysts of the size 20 to 30 microns and oval shaped organisms shown in the image below. I don't think there is any student left in this country who does not know anymore to differentiate between the Coccidian parasites. The whole world has repeatedly been talking about the cystoisospora is the long oval one with the 20 to 30 micrometer size. We know that cyclo is round and cryptosporidium is also round. Now crypto is and sporidium, these are kind of indicating that it is small. So cryptosporidium is small, 4 to 6 microns. Cyclospora is big. It is around 10 to 12 microns or 8 to 12 microns. 8 to 12 microns, right? And Cyclospora is the largest, 20 to 30. So it is 20 to 30 like this, and half of that, 10 to 15 in breadth. That is the dimensions of a cystoisospora. And we also know that crypto means hidden. So out of the three, this is the only one which does not show what? Autofluorescence. Autofluorescence. So if I take a fluorescent microscope and I put a specimen of cystoisospora and cyclospora without putting any fluorescent dye, I am going to see them shine like you have those fireflies which have shine on their own. Similarly, your cystoisospora and cyclospora, they shine on their own. But Cryptosporidium does not. So you have to put some fluorescent dye on top of Cryptosporidium to be able to detect. They are all important examples of diarrheas in HIV positive patients. In HIV patients, these are important causes of diarrhea. Right, you know this by now. What is Microsporidia? Microsporidia is really small. The name is micro only. It is so small. It is around 1 to 4 microns, and it has some polar filaments also. And there is always a confusion whether it is a parasite, whether it is a fungus, or whatever is it. They are not going to ask you much questions on Microsporidia. Not much work is being done on it throughout the country. Even in AIIMS, I don't think there's hardly like one person working on Microsporidia. So it will be really bad luck if you get a question, but even if you do, just imagine the question is going to be very similar to the question you get for Coccidian parasites. So don't become overconfident. The moment you look at such a question, don't become overconfident. Read what they're talking about. Look at the size. If they're giving you 1 to 4 microns, then stop and think if they're talking about Microsporidia, right? Okay. Not gram. So AFP positive are these all of these, all 4 are AFP positive. Microsporidia can also be seen on permanent stains such as the trichome stain, etc., which is done for all parasites anyways. Okay. Plasmodium falciparum, assertion reason, again very specific INI CET pattern question, doesn't show Schizont stage in the peripheral blood. So we know that falciparum doesn't show Schizont stage in the peripheral blood. We know that only the ring stage and the gametocyte stage is seen in falciparum. Rest any other stage is not seen. Why? Because they get sequestered. Sequestered means to go and hide in small places, okay. They've gone and hidden in small places, in small capillaries due to attachment to the membranes. I believe that both of these things are correct. Let's look at what they're talking about. So they are talking about cytoadherence. Cytoadherence is something which is shown specifically by Plasmodium falciparum, and we know falciparum means fatal, and falciparum is also the one which is most common in India. Okay, most common in India is falciparum, and it is fatal because it leads to cerebral malaria, algid malaria, black water fever, you name it, all the complications that you always keep on studying. What happens? The parasitized RBC, means the RBC with the parasite inside, the parasite starts translating certain proteins. What are these proteins? PFEMP means Plasmodium falciparum endothelial membrane protein. What does this PFEMP does? It produces these knobs. You know, these knobs make these RBCs sticky. So they become sticky for these membrane receptors and also for other RBCs. Which membrane is this? This is a capillary. This is a capillary of the brain, of the internal organs, kidney, wherever. So this is the endothelial cells. The endothelial cells have either CD36 or ICAM1 receptors. ICAM1 receptors. So these sticky RBCs, they go on and stick to these ICAM1 receptors, and they also stick to other normal RBCs. So what ends up happening is, inside the blood vessel, there is a conglomerate of RBCs, normal RBCs, parasitized RBCs, everyone has stuck together and make large you can say aggregates. Now that is going to interfere with the blood flow, that is going to lead to damage to the endothelial cells and all of the cerebral malaria, effusions, and all of the signs and symptoms that you see. And this is the reason that these parasitized RBCs have stuck and hiding inside these small blood vessels, that they are not free to come out in the peripheral blood and be seen. Because what do we do when we make a diagnosis? We collect the blood from here. We don't collect the blood from the cerebral capillaries. So I feel that both are correct, and reason is also explaining the assertion correctly. So what is this? It is B. Both assertion and reason are correct, and reason explains the assertion. So option A becomes your correct option out of these. Next, which of the following bacteria increased penicillin drug resistance is noted? So the moment you think about penicillin drug resistance, you think about Staph aureus, Yes, you think about your gram positives with the penicillin binding protein and everything. But look at the options. Donovanosis. Who can tell me who causes donovanosis? It is caused by Klebsiella granulomatous. This is also a sexually transmitted disease. Yes, it is one of the genital ulcers. Neisseria gonorrhoeae, which causes gonorrhea, again sexually transmitted. Chlamydia syphilis. So they want to ask you about penicillin drug resistance in sexually transmitted diseases. Now, which out of these is the correct answer, do you think? You remember we had talked about when we differentiate between Neisseria meningitidis and Neisseria gonorrhoeae, we realize that Neisseria meningitidis, the agent of meningitis, is more or less susceptible to most penicillins, whereas Neisseria gonorrhoeae shows increasing drug resistance because it produces penicillinase enzyme. So because of the beta lactamase, which is the penicillinase enzyme production, Neisseria gonorrhoeae shows penicillin drug resistance. So out of all of these, your answer is going to be Neisseria gonorrhoeae. Neisseria gonorrhoeae is one of the most favorite questions, especially it is compulsory that in INI CET you are going to get a question on STDs, and it is almost always on Neisseria. Okay, so you cannot afford to miss STDs. Disposable pipette tips are sterilized by using what? We are going to come back to Neisseria and we are going to discuss a lot more about Neisseria. I have many more questions planned. So if right now if you're feeling that I'm simply discussing questions and running forward, don't worry. I have related questions on these topics, and over there we are going to discuss. So Neisseria gonorrhoeae, who can tell me what is it? It is a gram-negative diplococcus. Yes, it is a gram-negative diplococcus, and we know that gonorrhea is kidney-shaped. So these are two kidney-shaped, they are gram-negative and they exist in a pair of two, and they are coccus, so diplococcus, and they don't have a capsule, no capsule. This capsule is present in meningitis and it is penicillin drug resistant. This so we all know. So whenever you get that picture of the kidney-shaped gram-negative diplococci, you definitely know you are talking about Neisseria gonorrhoeae. One important thing associated with Neisseria gonorrhoeae is that it leads to disseminated gonococcal infection, which is the DGI. And what are the risk factors? I have a question coming up for it. What happens in disseminated gonococcal infection? The Neisseria infection goes and spreads to everywhere. We know that the most important virulence factor for Neisseria gonorrhoeae is the pili, which help in adhesion to all mucosal surfaces. So not just STDs. So the most common infection in females is going to be cervicitis. Most common infection in males is going to be urethritis. Then wherever it will find the mucous membrane, if in the rectum it can cause proctitis, then in the eyes it can cause conjunctivitis. And we know that whenever there is disseminated gonococcal infection, it goes everywhere, head to toe. So it can also cause meningitis. Being an agent of gonorrhea, cause meningitis. It can cause endocarditis. It can cause your reactive arthritis, tenosynovitis. It can involve your bones, your joints, your heart. So basically complete dissemination, and you get the characteristic petechial rashes. Petechial rashes. So bleeding abnormalities are also seen with Neisseria gonorrhoeae. So whenever you get a question of gram-negative diplococci, petechial rashes, sexually active male, you know they are talking about Neisseria gonorrhoeae. So important things we have discussed about it. What was the protein or serotype associated? The porine proteins. The POR-B1 is responsible for causing disseminated gonococcal infections. Okay. Yes, let's come back to this. Disposable pipette tips. What do you think they are made up of? They're made up of plastic. So you will think that sterilized by which of the following methods? You will feel that autoclave's temperature is 121 degrees Celsius. And we always tell you cannot put plastic in autoclave, That is why we tell you whenever there is a question on the catheters, where will you, how will you sterilize catheters? Never say autoclave because it's high temperature. How will you sterilize petri dishes? Never say autoclave because it is high temperature. Hot air oven, definitely not. This is also 100 degrees Celsius. How can you put a plastic inside oven? Even inside our homes, we don't put. Microwave, definitely not. We cannot microwave. 70% ethanol is not a very, very low level disinfectant. So a low level disinfectant will anyways not achieve sterilization. Okay. So this INI CET, I believe there is definitely going to be a question from disinfection sterilization. It is a highly likely, thing that this year sterilization disinfection is definitely going to get asked. So what do you think is an option here? The option here is autoclave. Now, how is it autoclave? The answer becomes option D, A only. Why? Because these pipettes are made up of polypropylene, and all the other plastics that I was talking about are polystyrene. So polypropylene is able to withstand higher temperatures. But one thing that needs to be really taken into account is that they should be always and always wrapped in paper, in wrapped condition. So you do not put the pipettes just like that inside the autoclave. You always wrap them with some brown paper or some autoclavable paper, and then you put them inside the autoclaves. Now I feel this question is a little unfair, because only the people who have worked in laboratories know the answer to this question. You cannot expect a MBBS graduate to know this question, but it was asked nevertheless. So now it's one of the PYQs. That is why I believe to include it over here. So this is the pattern I am anticipating is going to get asked with sterilization disinfection this time. So please read the Spalding's classification very, very clearly. Spalding's classification. Please read it, and not just read it, apply it according to the items. So they are going to give you the option of some item and then ask you which is the best method of sterilization for this. They are not going to ask you the classification directly or the classification of the sterilants and all. That is too easy questions. Application based application, that is what INICET is all about. You read your facts, they ask you to apply the simple facts. Okay. Parvo B19, parvovirus B19 is associated with all except buzzword. Fever with petechial rash, of course, it causes what? It causes erythema infectiosum. Erythema infectiosum, also called as slapped cheek appearance, the most famous baby ever. This is the most famous baby ever. The one who is sitting nicely even after getting two tight slaps. So slapped cheek appearance. Erythema infectiosum, parvovirus B19, the only parvovirus of importance that you have to know. And what do we know about parvovirus? Parvo single stranded hai. So parvo single stranded DNA. Parvo non enveloped hai. Parvo सबसे छोटा है, छोटा सा baby with the slapped cheek, छोटा सा virus. It is the smallest DNA virus. Smallest DNA virus, where we know that the largest DNA viruses are the pox in a box. Pox viruses are the largest pox in a box viruses, right? This is what we know about parvovirus. We know that P for parvovirus loves the P antigen on your erythroblasts. So your precursor RBCs, immature RBCs, they are going to attack, this virus attacks these RBCs, the premature, see, it loves babies. This baby, and also remember baby RBCs, the progenitor cells, the erythroblasts, the cells which are going to turn into RBCs, they attack the P antigen on them. So what is it going to do? It is going to lead to aplastic crisis, because these RBCs will not be able to develop, and also it will lead to damage of these RBCs. So it also leads to such pneumonias, hemolysis. So it says transient aplastic crisis with hemolytic anemia. Of course, if it is going to attack the RBCs, it is going to lyse the RBC, it is going to lead to hemolytic anemia. Aplastic crisis of course going to happen, because it will attack the progenitor cells. Aplastic anemia in immunocompromised, not aplastic anemia, it's going to be pure B cell aplasia, okay, pure RBC aplasia, red cell aplasia. Hydrops fetalis, Yes, of course. Which kind? Non-immune hydrops fetalis, meaning that when there was RH incompatibility between the mother and the child, what was happening? The maternal RH antibodies were attacking the RBCs of the baby. When there is an RH negative mother and RH positive baby, that is what happens in hydrops fetalis. But here, instead of maternal antibodies, who is attacking the RBC of babies? It is the parvovirus which is attacking. So hydrops fetalis is a congenital infection of parvovirus B19. So if at the time of pregnancy the lady gets it and congenital infection is hydrops fetalis. So except, I believe this is correct, this is correct, this is correct. So C is your option here, because aplastic anemia nahi, it's going to lead to pure RBC aplasias. Okay, only RBCs. Which among the following is the most specific disease of Streptococcus agalacti? Now, Streptococcus agalacti is what? It is group B Streptococcus. Amongst the beta hemolytic streptococci, the group B Streptococcus. What does it lead to? Most specific disease. It leads to all of these. Now, who causes infective endocarditis? Overall, most common cause of infective endocarditis? Staph aureus, always. Followed by Staph epidermidis. And if it is a native valve, not a prosthetic valve, then what is the most common cause? Yes, you're correct, Aryan, but let's come on to that option. What is the most common? Streptococcus. Which one? The one in our commensal in our mouth, viridans, because we know how does infective endocarditis happen. Brushing the teeth, transient bacteremia goes and settles inside the heart, causes vegetations, endocarditis. So Streptococcus viridans. Dental caries, again it has to be something which is a commensal in my mouth. So it has to be Streptococcus. Streptococcus, which one? Mitis. Then pharyngitis with or without tonsillitis. We all know that it is the group A Streptococcus, the beta hemolytic group A Streptococcus, the Streptococcus pyogenes, which is responsible for pharyngitis. So neonatal sepsis is your best answer here, either neonatal sepsis or neonatal meningitis. Why? Because this sits in the birth canal. It is a commensal in the birth canal of the mother, and at the time of delivery, while the baby is passing through the birth canal, it acquires the group B Streptococcus, and then neonatal sepsis, either early onset neonatal sepsis or late onset neonatal sepsis can happen. Early means when it happens less than 7 days age of baby, and late is when it happens after 7 days of the age of the baby. Okay, correct. A lot of you are answering correctly. A patient came to OPD with injury caused by rusted metal. What is the mechanism of action of tetanus toxin? So they did not even need to give you this history. They are straight away asked the mechanism of action of tetanus toxin. Inhibition of protein synthesis. We have just seen that inhibition of protein synthesis is too important. It is C. diphtheria, and more than important than that, it is the verocytotoxin or the Shiga toxin. Yes, the Shiga toxin, which leads to 60S ribosome inhibition, leading to inhibition of protein synthesis. Inhibition of release of acetylcholine. Acetylcholine is an excitatory neurotransmitter. So if we will inhibit acetylcholine, it will lead to flaccid paralysis. That looks to me like the Botox injection, because I give the Botox injection here to reduce the contraction of muscles so that the wrinkles go away. So yes, you're correct, Arun. So inhibit of ACH is going to be botulinum toxin for me. Botulinum toxin. So it is definitely not tetanus toxin. Inhibition of release of GABA and glycine. These are inhibitory neurotransmitters. So if I inhibit them, there is going to be continuous spasticity of the muscles. So it will lead to opisthotonus. Opisthotonus. What else? Rhizus sardonicus. All of the spastic paralysis of the body, and inhibit the release of norepinephrine. That is a pharma question, some alpha agonist maybe. Okay, so you have your answer, which is it inhibits the release of GABA glycine, because tetanus leads to continued contracted state of the muscles and ultimately the arrest of the respiratory muscles and death of the patient. Which of the following is spread via all the components of the blood. You see, that is the beauty of INICET. You have read already, you know, syphilis can be blood transmitted, toxoplasma can be blood transmitted, malaria can be blood transmitted, filaria can be blood transmitted. You are thinking, wow, I have read a lot. What will they ask you? All the components of the blood. Now, you already know the answer, you have read it, but at this time you should be able to apply your knowledge. So, what is the knowledge? What is the knowledge? Toxoplasma, how is it spread? It is spread only through nucleated cells. Only the nucleated cells. It only infects the nucleated cells. So, it will only go to the WBCs, right? Not go to the RBCs. What about malaria? Only RBCs, never nucleated cells, only non-nucleated cells. So, all components of blood is not true for malaria. Yes, Aryan? So, it cannot be true for toxoplasmosis because it won't be spread through RBCs. If I only give packed cell, it won't get transmitted. If I don't give RBCs, malaria won't be transmitted. What about filarial infection? It is through plasma, because why? It comes through the chyle, it comes through the lymphatics. So, the answer is syphilis. Syphilis is a bacteria. It can get transmitted through all the blood products. All the components of the blood can transmit syphilis, right? So, that is INICET for you. You know the answer, but it will really itch for you to say malaria, because you keep on learning malaria is through blood transmission, malaria is through blood transfusion, but then the catch is all the components, okay? Please do not ignore syphilis. Of course, syphilis can transmit through blood transfusions, right? A female patient presents with swollen Bartholin glands. This is telling me that now the infection has gone beyond urethritis, beyond cervicitis. It is now involving some part of the other genital area, pelvis of the patient. Okay, discharging pus showed gram-negative intracellular diplococci. The moment you see it, you know you are going to mark Neisseria. What is the organism? Neisseria gonorrhoeae. Not even a problem. So, can you tell me the diagnostic stage of chlamydia? What does chlamydia form? We have, for the longest time, we used to think that chlamydia is a virus because it was so small and it had a life cycle. It would form elementary bodies and reticulate bodies, and one very specific thing that virus like it used to produce, inclusion bodies. Inclusion bodies. So, the reticulate bodies are the inclusion bodies which are produced by chlamydia, which we are going to see in chlamydia. Chancroid. Who causes chancroid? Chancroid is caused by H. ducrei, Haemophilus ducrei, which shows you what? The safety pin appearance. Safety pin appearance or bipolar staining. And what about syphilis? Syphilis is a spirochete. It is Treponema pallidum, which is a spirochete. So, can you tell me the safety pin appearances? A very famous mnemonic is there. Can be very high yield. What are these? These are all your bipolar staining. Examples of bipolar staining bacteria or safety pin appearance bacteria. So, K for can, K for Klebsiella. But of course, life is not so simple, and this is also a special kind of a staining. So, it cannot be pneumonia. It has to be Klebsiella granulomatous. And we have just seen what does granulomatous cause? Donovanosis, which is also a sexually transmitted ulcerative disease. B, Burkholderia. V, Vibrio. But of course, life is not so simple. So, which Vibrio? Not cholerae. Parahemolyticus. Vibrio parahemolyticus. H, Hemophilus, of course. But life is not so simple. So why influenzae? No, not influenzae. H. ducrei causes what? We have just seen causes chancroid. Chancroid, oid. We will just see what is oid. And why is Yersinia? Which Yersinia? Yersinia pestis, which causes plague. These are all the agents which show bipolar staining or safety pin appearance. Right? So of course, gram negative intracellular diplococci, Neisseria gonorrhoeae. Chalo. Which, now this is a very, very weird question. But they gave the options very simple to me. What did they do? The only knowledge that I needed to have was that Helicobacter can cause gastric maltoma. You believe it? Yes, Helicobacter can cause gastric cancers. We all know this. So 1D, actually there's just one option which is 1D. So it is option D. But let's look at the other ones also. So according to this 2A, ocular myeltoma is chlamydia. So it has been seen that chlamydia psittaci, which is an agent of psittacosis. Psittacosis, which is actually a respiratory infection through the droppings of parakeets. P for psittaci, P for parrots or parakeets. But it can also lead to, some strains can lead to ocular maltomas. Then small bowel is Campylobacter. We know Campylobacter leads to gastroenteritis and food poisoning. So it is going to affect your intestines or the small intestine. Skin maltoma is Borrelia. Borrelia burgdorferi causes Lyme disease. So at the site of bite of the tick and mite, you're going to get borreliosis. Okay, so very, very simple. Weird, strange question, but becomes easy to solve because the only knowledge I needed to have was Helicobacter is associated with gastric cancers. Now, this is the most boring question ever. I think this has been repeated in 2025. I don't know which examiners were setting the exam paper. They were just completely obsessed with this parasite. Each and every exam this has been asked. A patient presented with perianal pruritus. The moment they write perianal pruritus, you know what they are talking about. Perianal pruritus, pins and needles in the perianus region. So, pins and needles, pinworm, right? Pins and needles in the anus is what? Pinworm. What is pinworm? Enterobius vermicularis. And we also know Scotch tape examination. They might write the mother saw threads in the underwear. They might write the sample was taken using NIH swab. Any of this if they write, you know. And this egg, what can you see? The plano-convex, the D-shaped plano-convex eggs. I mean, this is so boring now to even discuss. Enterobius vermicularis or pinworm. What is Ankylostoma duodenale? Hookworm. Hookworm. What is H. nana? H. nana is H. nana only. What is Trichuris trichiura? What does Trichuris trichiura cause? It causes dysentery. Dysentery. Important cause of dysentery. Now, eggs of all of these we are going to discuss in a little bit. So, let's just discuss the egg of Trichuris. We all know it is the barrel shaped or the bomb shaped. So, it is like this barrel with the embryo inside and then two mucus plugs on the two ends. That is the egg of Trichuris for all of us and it causes dysentery. This brings me to one important thing that we should discuss here. Iron deficiency anemia. Iron deficiency anemia. Three important parasitic causes. So, okay, two important parasitic causes. One is the guy who's leading to a lot of blood loss in the form of dysentery. So, you have Trichuris trichiura. The other one latches onto the intestine and sucks out all the blood. That is why it has the name Necator americanus. Necator is like, he's also called as the great American killer worm because it totally is sucking onto the blood like nectar. So, Necator americanus, they have cutting teeth, they have cutting plates and sharp teeth like that of a snake. Similarly, Ankylostoma. So, all the hookworms, they lead to iron deficiency anemias. Ascaris lumbricoides, Ascaris is not a hookworm. Hookworm is different. Ascaris lumbricoides can lead to balls of worms inside the intestine. So many worms will be there that it can lead to obstruction syndromes, constipation, malnutrition, and as a result of malnutrition, of course, there can be anemia. But specifically iron deficiency anemia is because of blood loss. And then the other one, which is the megaloblastic anemia, because of B12 deficiency, because I know that B12 is absorbed through the intestine and there is a very, very huge parasite sitting in the intestine, which is not like Trump, okay. There is a huge parasite sitting in the intestine which will not allow any B12 to get absorbed. Diphyllobothrium latum. Diphyllobothrium latum is not just the largest cestode, it is the largest parasite of the human. Okay, chalo. No. Which is the largest parasite? No, yeah, D latum is the largest parasite. Sorry for the confusion. Okay, Enterobius vermicularis, done. Now, which HPV genotype is commonly implicated in cervical cancer? Now, all of these are important genotypes. Some of you might even tell the answer 1618. How to remember, ma'am? So, this is a stupid mnemonic, a very weird stupid mnemonic, and Hindi speakers are going to have a benefit over this. So, 6-11 chhod 11. Okay, 6-11 chhod mere 11 becomes low risk. These are low risk. Low risk. What is the mnemonic? 6-11 chhod 11. Okay, छोड़ देते हैं, नहीं कराते कैंसर. 16-18 खतरनाक सीन. 16-18 खतरनाक सीन. क्या हो गए? कैंसर्स, हाई रिस्क फॉर कैंसर्स. देन 1-5 छोटे नंबर, सिंपली वॉट्स कराएंगे. 31-33 also associated with cervical cancer but less likely associated. So the highest risk is 16-18. So actually the two most important things you have to remember is 6-11 16-18. 6-11 chhod 11 low risk, 16-18 khatarnak scene. Okay, so you get high risk serotype 16-18. So this becomes your answer. Right, another question which is asked from HPV usually is which are the genes which lead to cancers. So you have the early genes E6 and E7. E6 is going to inhibit what? E7 is going to inhibit what? E6 is going to inhibit the tumor suppressor gene. Chat box, come on, which tumor suppressor gene is E6 going to inhibit? P53, yes, and this one is going to inhibit retinoblastoma gene. This is actually a PYQ. E7 inhibits retinoblastoma. Yes, correctly answered. P53. Okay, let's go. What is happening? Autoinfection in seen. In case of which parasitic infection? Autoinfection. Now, this is actually May 2025 PYQ. This May 2025, this was asked. Ascaris lumbricoides. Okay, no, not so much. Ankylosarcoma duodenale hookworm, skin penetration. कहाँ से autoinfection? Not at all. Strongyloids, stercoralis and H. nana. Now, both of these cause autoinfection. Strongyloids is also responsible. H. nana is also responsible. Now what? How do we decide? So some teachers were saying H. nana, some teachers were saying strongyloids. But see, H. nana can lead to autoinfection. The problem is that autoinfection is characteristically associated with strongyloids, because if we go to our discussion, you remember we had said that this rhabditiform larva, which is going and deciding on its own to go and cause autoinfection, is very, very characteristic of strongyloids. So hyperinfection and autoinfection are characteristic features of strongyloids. So the best possible answer, the best answer out of these two is actually strongyloids. So this is just hard luck kind of a question, just to decrease, I don't know, the passing percentage or for what reason this question was given or who said this question. So now quickly, it's beyond our concern. What is our concern? The mnemonic for autoinfection. Chest. It is a very, very famous mnemonic, already existing mnemonic. Chest is Cryptosporidium. Now some of you say Coccidian parasites. Now please understand that the oocysts of Cryptosporidium do not have a double wall. Because obviously, isn't this obvious, Nelson, that why hyperinfection occurs particularly in immunocompromised? Because the body's immunity is not able to attack the parasite and control it, right? Now, some of you say Coccidian parasites, but it is Cryptosporidium. Why? Let's talk about it. When you look at the 3 Coccidian parasites, the Cryptosporidium has naked sporozoites. There are these 4 sporozoites which are naked. It only has a single cyst wall, whereas Cyclospora has 2 cyst walls and Cystoisospora also has 2 cyst walls. That is why it is called as Cystoisospora. See, Cystoisospora. What is the meaning? Spora is because it is a sporozone parasite, cysto because it is inside a cyst, and iso means what? Iso means identical. So, the 2 spores inside are identical and you have the 4 sporozoites inside. So, total 8 sporozoites in Cystoisospora. What about Cyclospora? Total 4. 2 and 2, but in 2 cysts. So, this also has a double wall, this has a double wall. Cryptosporidium has naked oocyst, it does not have a double wall. Okay, so I should not have encircled it. It is a naked oocyst. So, that is why autoinfection is very, very easy, because it has a thin wall and it is immediately infective. The moment it is laid out, because of this thin wall, immediately infective, and because of that, autoinfection is possible with Cryptosporidium only. H. nana. Enterobius vermicularis. This guy always sneaks into all the mnemonics. Then strongyloids and tinea. But which tinea? Only the neurocysticercosis tinea, not intestinal teniasis. So only and only tinea solium, not saginata. Okay, not the pork tapeworm, but the cysticercosis one in which you are ingesting eggs, not the one in which you are ingesting larva. Okay, I hope you understand what I am saying. If I am not, that is your sign to go and revise. So, this is your mnemonic for agents of autoinfection, right? Let's move ahead. Which of the following is a thermally dimorphic fungus? We understand thermally dimorphic fungi are what? They are the bad boys, the hot boys, the bad boys who are not, you can say, what to say, they are not loyal to anybody. So, you give them 37 degrees Celsius, they turn into yeasts. You give them 25 degrees Celsius, they turn into molds. You never know how they are going to behave with you. Some days they are sweet, some days they are rude. So, these are the dimorphic fungi. So, is not Coccidioides immitis true, Histoplasma true, Blastomyces true, Cryptococcus is a true yeast. It is a true yeast. It is a round yeast with narrow based budding. What about Blastomyces? It is the bad boy. It is the bad boy because it is broad based budding. BBB, Blastomyces dermatitis. Also, the bad boy will belong to where? North America. So, North American disease, Ohio disease, North American disease, and then Chicago disease. And what is the name of the bad boy? Gilchrist. Gilchrist. So, it is also Gilchrist disease. Oh. Gilchrist disease, right? What about Histoplasma capsulatum? You see the intracellular. So, what will you see? You will see this big macrophage inside which you will see your narrow base budding yeast cell with the crescent or the moon shape. And this hot boy, H for hot boy, is going to call you what? He is going to call you darling. Darling's disease. Where does he belong? Ohio. He is going to take you in a cave. Caves disease, anything you can talk about. Okay, basically leads to granulomatous infections. Then what about Coccidioides? Coccidioides, where do these hot boys go to party? To the places where the coolest parties happen. Where do the coolest parties happen? They happen in Las Vegas. What is Las Vegas? Las Vegas is a desert. So, desert rheumatism, valley fever, anything you want to call Coccidioides. And what is this hot boy going to do? He is going to ghost you. So, you will see ghost cells in Coccidioides immitis. You will see ghost cells. Another way to remember the list is an existing mnemonic in the market. Body heat, probably, double P, probably has double P, changes shape. So you have blastomyces, you have histoplasma, PP, paracoccidio, coccidio, we have just seen, okay. What about this penicillium or Talaromyces marnefi? Talaromyces marnefi. Please remember Talaromyces marnefi or Penicillium marnefi is also a dimorphic fungus, but it does not lead to systemic mycosis or bloodstream infections. Okay, it leads to opportunistic infections. And S is for Sporothrix schenki, sporotrichosis or Sporothrix schenki. Out of this, Sporothrix schenki is a superficial skin infection. Penicillium is a opportunistic infection in HIV positive people. Rest all blasto, histo, paracoccidio, coccidio, they will all lead to systemic mycosis or bloodstream infections. How do we remember that? Hot boys can party. Hot boys can party. Hot boys can party. And then we can remember the entire story through hot boys can party. The hot boy is going to take you into a cave. It's going to call you darling. The boy is a bad boy because it is the BBB and also the gene. The adhesine protein is bad one. Bad one adhesine is the one which is responsible for binding in this. Then it will go to party. The coolest parties happen in Las Vegas, which is a desert. So desert, rheumatism, valley fever, and finally the boy is going to ghost you. So the ghost cells are going to be seen in coccidioides. What about paracoccidioides? The name itself says paracoccidioides brasilensis. So Brazil is in South America, so South American disease, and also you can see the Mickey Mouse appearance, the sailor's wheel appearance and everything. Because how is the party going to shift from North America to South America? Through the ship. So the sailor's wheel, mariner's wheel, pilot wheel, Mickey Mouse appearance. I am throwing these words right now because I assume that these are very, very repeatedly asked topics, and of course stay tuned for the marathon wherein I am going to talk to you about all of this with the images. Okay. So this answer is of course Cryptococcus neoformans. Let's move ahead. This is the most troublesome slide ever. Tick, louse, mite, rat, flea, how to remember. So now see, the good thing about is this question is that they are only asking you about the rickettsial organisms, not the other tick and louse, mite, flea borne infections, only the rickettsial group. And I always tell you to remember the Rickettsial group with this Rickettsial railway station. So imagine there is a Rickettsial railway station and there are two trains going on this station, a typhus train and a spotted fever express. Who is there on the spotted fever express? An American guy Rocky and an Indian prince. So both of these are the tick transmitted. So on the spotted fever you have Rocky Mountain spotted fever caused by Rickettsial rickettsii. How to remember? Rick spotted tick. Rick spotted tick. So you know it is tick transmitted and Rickettsial rickettsii causing Rocky Mountain spotted fever, and along with this the Indian prince. So Indian tick typhus, name itself says tick, so they will not ask you this question, but they might ask Rickettsia conori. So he is a crown prince. So if he is a crown prince, he is conori. Okay, great. Then what is happening in the typhus train? So this was the spotted fever express. What's happening in the typhus train? There is a soldier who has lice in his head. We always know soldiers, they live in trenches, they live in overcrowding. They all get lice in their hair. And who is he? He is a mouse, a rat infested with rat flea. So the other two rickettsial are going to happen like this. I always tell you that whenever there is louse, it is going to lead to epidemics. Louse always leads to epidemics. When we were in school, don't know about your generation, but mostly it is seen that one child gets louse, there is an outbreak in the entire class because lice is spread very fast. So louse infested soldier is pro-war, right? So he is Rickettsia provazicai leading to epidemic typhus. Epidemic typhus, Rickettsia provazicai, and the agent is louse or the lice. What about the mouse? Rat flea. Then the other one which is remaining, since they are on the same train, so epidemic and endemic will be on the same train. So the endemic typhus with the tough mouse, Rickettsia typhi. So rat flea. So becomes very easy for me. Just remember typhus strain, pro-war soldier with louse in head. So it will become Rickettsial provazicae leading to epidemic typhus because of louse. Then on the same train is the flea infested rat. So you have endemic typhus by rat flea by Rickettsial typhi. Then on the spotted fever express, you have the American man Rocky. So Rick spotted tick, Rickettsial rickettsii, Rocky Mountain spotted fever. Indian tick typhus, tick transmitted by the crown prince Rickettsial conori. Right? Becomes easy for me to remember. So now tick, only two, either Rick spotted tick or Indian tick typhus. So Rocky Mountain spotted fever, Rick spotted tick becomes tick. Louse always will lead to epidemics. Rat flea or mite, how to not confuse. Who was there on the train with the soldier? It was the rat on the train. So with epidemic will go the endemic. So rat flea is endemic. Last remaining mite is rickettsial pox. It is caused by the mighty mouse. Rickettsial acari. Rickettsial acari. Okay, fine. So now we can mark it is A3, only one with A3, option C. A3, B1. No, this is not B1. What is the answer here now? A is 4, sorry. A4, B3, so option B is the answer. Yes, B, correct. Great. The phenomenon shown in the image is shown by which organism? What is the phenomenon here? You see what? What can you see? You see the lanceolate shaped diplococci with the capsule, and the capsule has swollen up. Swollen up. How do you know it has swollen up? When you look at this one, the capsule is right here. But if you look at this one, the capsule is so swollen up. So the swollen capsule is what? The Q-lung reaction or the Neufeld reaction. Yes, correctly said. Q-lung reaction or the Neufeld reaction in which we are putting the anti-sera. So this is of course Streptococcus pneumoniae. Streptococcus pneumoniae. What are the other features of Streptococcus pneumoniae? Q-lung reaction, optochin sensitive, bile soluble, inulin fermenting, and which colonies? Carom coin or draftsman colonies. All features of strep pneumoniae. What about H. influenzae? Satellitism, remember? Clostridium tetani, drumstick appearance. Drumstick appearance, the terminal round spores. Drumstick appearances, Clostridium tetani. Corynebacterium diphtheria, Chinese letter, uniform pattern with the metachromatic granules. The metachromatic granules. This is Corynebacterium diphtheria. Let's go. Okay, important tests for Corynebacterium diphtheria. LX gel precipitation. We have one question, so we'll look at it there only. Which immunoglobulin showed in the images? This is like such a simple question. Just to increase the cutoff of that year, they have given this question. Come on, chat box. What is this? This is a dimer. This is a dimer. One antibody is here. One antibody is here. So this is a dimer. Which antibody is a dimer? Yes, option B, IgA. This is IgA. You can see that this is the secretory component and this is the J chain. In which other antibody is this J chain present? In IgM, which is a pentamer. You see this J chain which is connecting the adjacent to Schick test. Okay. The J chain is the one connecting the adjacent to antibodies. This is the J chain. This is a pentamer. This is IgM. IgM is the biggest letter. So the biggest antibody. Rest all IgG, IgD. They are all IgE. They are all monomers. Monomers means single units. What else is there about IgA? IgA, A stands for alternate pathway. So it activates the alternate pathway of complement. Alternate complement pathway. This is also called as the secretory antibody or the mucosal antibody. Why? Because it is secreted in the breast milk and it is present in the gut mucosa. So it protects me from all of these diseases of the gut because it is secretory and mucosal antibody. And this is the alternate or the complement pathway. What about IgM? IgM rises in the acute illness. It is the first antibody to rise. It rises in the acute phase of illness. Protests against giardia. Okay. Affinity and avidity. Okay, I'll just explain affinity and avidity. So the thing with affinity and avidity is, imagine affinity. Affinity is equal to affair. And avidity is equal to marriage. That is how you think. So whenever there is an affair, there is infatuation, there is a lot of attraction. So the point of attraction is simple. I like you, you like me, but strong attraction is there. Oh, I'll leave the world for you, I'll fight with my parents for you, everything. That is affinity. What is marriage? Multiple points of attachment are there. We have children together, we have bought a house together, we have loans to pay together, we have old parents together. So we have multiple points of attachment. Now the point of attachment of individual attachment is not so strong. So avidity is many weak bonds together make one strong bond, whereas affinity is one single bond but very, very strong. So if you have this antigen, okay, so the antibody is binding from one single point to this antigen, one single point, but the force of attraction between these two is very, very strong. Whereas in avidity, what happens if this is an antigen, the antibody has come and bound from multiple sites to this particular antigen. So multiple points of attachment are there by the antibody. That is avidity. So your pentamers like IgM, while each individual arm might be weak, okay, it is, the overall attachment is stronger. Another way to imagine is, Sunny Deol has 2.5 kilo ka haath, okay. So with one hand only he'll be able to grab onto something and be strong. That is affinity. But I am weak. My heart is 500 gram. So what will I do? I will have many hands like Durga and I will hold from multiple hands. So who is stronger, Sunny Deol or Durga? Obviously Durga is stronger. So avidity is going to be stronger. I hope that clarifies. Okay. Then IgG, so pentamer we were talking about, IgM is in acute phase. Another way to remember is we write them in the sequence GAMDE. Why GAMDE? This is the increasing order of concentration in the serum. So which has the maximum concentration? Which has the maximum concentration? Which has the least concentration in the serum? Come on, chat box. Protest against giardia. Okay. And what about IgE? What about IgE? Yes, G has the maximum concentration and E has the minimum concentration in the body. Okay, what about IgE? IgE is always U. So just remember, IgE is equal to U. U. What is U? Allergy. U, I am allergic to you. I am atopic. I am anaphylactic. U, parasites, squiggly worms, parasitic infections. IgE will rise. What else? U, heat labile. The moment I touch something hot, E, I say E, okay? So it is heat labile. That is all IgE. And of course, it will have the least concentration in the serum and it is a monomer. It is a monomer just like IgG and IgD. IgD has no particular role except the fact that IgM and IgD are B cell markers. So this is a B cell receptor itself is an antibody. So what is this antibody which is a B cell receptor itself? It is either IgD or IgM. Okay. Great. I think more or less most important. So IgG will activate your complement pathway. It rises in past infection. I think all of this is general knowledge by now. Great. Okay. Kanagawa phenomenon is shown by Kanagawa phenomenon on Vagatsuma agar. This is the agar. This is Kanagawa phenomenon on Vagatsuma agar. Everything happens on the shore of Japan by ingestion of oysters, Japanese seafood. So, Kanagawa phenomenon simply means beta hemolysis. Vagatsuma agar is simply an alkaline blood agar. So, simply a different type of a blood agar used and beta hemolysis being shown. Same bacteria is showing you green colonies on TCBS. Now, TCBS shows yellow colonies for Vibrio cholerae and we are talking about seafood ingestion. So, of course, Vibrio cholerae can't be true. Shigella dysentery is not true. Staph aureus is not true. Vibrio parahemolyticus, Kanagawa phenomenon on Vagatsuma agar. What else is Vibrio parahemolyticus? Okay. What else is true about Vibrio parahemolyticus? One, it shows Kanagawa phenomenon on Vagatsuma agar. Two, it shows green colonies on TCBS. Three, we know it is true. It is a halophilic vibrio. It is a halophilic vibrio. So, how do we remember halophilic vibrios? Always people vacation in Andaman. That is our mnemonic. People vacation in Andaman. We always write like this. Why? Because all halophilic vibrios are salt loving. So, they will always be found on the sea, in the sea areas, and Andaman is one of the very famous beach destinations. So, Vibrio parahemolyticus. Parahemolyticus. Why are we remembering in this order? We will just see. Vibrio vulnificus. Vulnificus is also called as the wound maker. Wound maker. It causes deadly skin infections. Then we have Andaman. Vibrio alginolyticus. Alginolyticus. Why have we remembered in this order? Because this is the order which will tell me the concentration of salt tolerated by each one of them. So, parahemolyticus is 7 to 8%, 7%, vulnificans 8%, alginolyticus 10%. Cholerae is less than 6%. So, maximum amount of salt is tolerated by Vibrio alginolyticus. Can tolerate 10% NaCl. Loves so much salt. So, that is parahemolyticus loves 7% salt concentration. Then Vibrio cholerae shows darting motility. This guy does not. This shows no darting motility. So, there is no darting motility. One very important another feature of Vibrio parahemolyticus, it shows swarming. Yes, correct. Who is written? Raju. Swarming on blood agar. So, I have failed to get you the image. But what is our mnemonic for swarming on blood agar? Bichara. We always imagine that there is a bichara astronaut who is making a PPT on Mars. There's a bichara astronaut who's sitting on Mars, the red planet. Fission stream appearance. Correct. We will just talk about it. So, bichara astronaut is sitting on Mars and he has to make a PPT sitting with a laptop. Right, that is our swarming motility. So, you can imagine the blood agar plate is completely red and the Mars is a red planet. So, it's easier for us to imagine. I wish I had gotten the image. It is missing. But you can always find it on my social media. The image is there. So, Bechara is Bacillus cereus. He is quite serious na. Wahan bhi PPT bana rahe. Vibrio parahemolyticus. Then you have Proteus, the prototype of swarming motility. T for Clostridium tetani, and Mars, the red planet, Serratia marcescens. All of these show swarming on blood agar. So, bichara making PPT on Mars. Bacillus cereus, Vibrio parahemolyticus, Proteus, Clostridium tetani, Serratia marcescens. Right. So, I understand that this is Vibrio parahemolyticus. Swarming, no darting, Vagatsuma, fission stream appearance. Great. Which of the following statements are true? Okay. So, the people who are writing fish in stream appearance, who shows the school of fish appearance? Which bacteria shows the school of fish appearance? Chat box, okay? Safety pin appearance is, yes, the one which shows safety pin appearance shows school office. Okay. Vidal test is positive in first week of enteric fever. Is that true? Of course not. This is not true. We know that Vidal test is the detection of antibodies, and antibodies will only appear after 1 week of illness in this. Yes, hemophilus decree. Correct, Raju. So, this will only appear, the antibodies will only appear after first week of illness, right? So, in the second week, Vidal test can be positive. Standard agglutination test is used for brucellosis. What is our mnemonic? Cat sat on a mat. Whom did she sit with? With my brother Lee. With my brother Lee. Mycoplasma, cold agglutination test. Brucellosis or brucella, standard agglutination test. Leptospira, microscopic agglutination test or MAT. So, SAT is for brucellosis. This seems like a correct statement. Live organisms are used in MAT? No. Antigen is used in MAT. SAT-CAT MAT tests are confirmatory test? No. Not even Vidal is confirmatory. These are gold standard agglutination tests, gold standard tests. If they ask you confirmatory, no. You have to write that these are gold standard tests, CAT, SAT, MAT. VDRL is specific test for syphilis? No. It is not specific. It is non-specific. Why? Because we are using non-treponemal. This is a standard test. So, what should they have written here? Standard test for syphilis. That is why we call it STS, standard test for syphilis, also called as non-treponemal test, where we use the cardiolipin antigen and see the reagent antibodies. Okay. So, guys, there is a lot of information, diarrhea, which is happening from my mouth. So, please try to capture everything that I am saying, because it's difficult to write everything that I am saying, and the class will go until 11 p.m. Okay. Great. So, what is correct over here? SAT is used for brucellosis. Great. Awesome. What is brucella, by the way? Brucella is the distant cousin of typhoid. So, you have the night sweats and fevers. So, any patient with similar symptoms like that of typhoid, you should also think of brucella. But what is there going to be? History of ingestion of raw milk. Raw milk. Diagnosis, of course, blood culture. Biphasic blood culture, Castaneda's blood culture bottle. Okay, great. Two morphological forms are seen in all except, basically all protozoa. All protozoa exist in trophozoite form and cyst form, except the one whose name starts with T. T for Trichomonas, T for trophozoite only. Trophozoite only. Naegleria, yes, there is an amoeboid form, there is a flagellate form. So, there is amoeboid form, flagellate form and cyst form. Three forms are there. Giardia, there is a trophozoite form, there is a cyst form. Acanthamoeba, trophozoite and cyst. Which the trophozoite has spines in Acanthamoeba. In Naegleria, they have lobopodia or pseudopodia. So, answer is Trichomonas. Trichomonas is only trophozoite. How do you draw this trophozoite? Simply draw a pear-shaped body, then draw one long undulating flagellum, and then draw four anterior flagella. Four anterior flagella. Then there is the nucleus. And the ribosomes, etc., that is beyond the point, not so important. So, this is the trophozoite. You should be able to identify the trophozoite. Very famous mnemonic, Trichomonas is a sexually transmitted disease responsible for causing vulvovaginitis, cervicitis, urethritis, especially in females. They love diamonds. So, diamonds media. Now, I don't like to tell this mnemonic. Why? Because diamonds media can be used for any protozoan parasite. For any protestant parasite. If you tell me Giardia will not grow on diamonds media, that is wrong. If you tell me Entamoeba will not grow on diamonds media, that is wrong. They will all grow on diamonds media. But it is specifically for MCQs, mostly asked with trophozoite. And you get the strawberry cervix. Strawberry cervix. And the green frothy discharge. The green frothy discharge. Treatment of choice, metronidazole, because it's parasite. So frothy green discharge is what is seen. Okay. Which of the following is not true regarding Toxoplasma gondii infection? Toxoplasma gondii, another sporozoan protestant parasite. Cat, always remember, cat. Freshly passed oocyst is infective. Tachyzoids are seen in acute infection. Bradyzoids are present in tissue cyst. Congenital infection is more severe if the mother acquires primary infection during pregnancy. Yes, congenital toxoplasmosis is very, very severe. So, can you tell me the triad of congenital toxoplasmosis? I always tell you to remember this baby cat with these spotted head. It's a baby cat. So, let's make a small little baby cat. Yes. And what does she have? She has red eyes. This is congenital toxoplasmosis. Congenital toxoplasmosis. So, what are the features? Big head means hydrocephalus. Hydrocephalus, congenital toxoplasmosis. Red eyes means chorioretinitis. Chorioretinitis. Spotted head means what? Intracranial calcifications. Intracranial calcifications. Congenital toxoplasmosis features done. And it's a baby cat. Why the cat? Why the cat? Because cat is the definitive host for toxoplasma, man is the intermediate host for toxoplasma. 3 stages are there: tachyzoid, bradyzoid and yes, correct. Tachyzoid, bradyzoid and oocyst stage is there. Oocyst stage is the stage which is passed in the feces of the cat. So, let's look at the life cycle. We can see that the cat is passing unsporulated oocyst which is becoming sporulated in the soil. So, if you say that through ingestion of contaminated food and water, I am ingesting oocyst, yes, correct, oocyst is an infective stage, but it is not immediately infective. It has to first sporulate in the soil. Then it goes to the so food and water, if you are ingesting sporulated oocyst becomes your mode of infection. If you are ingesting the raw meat, you are ingesting the tissue cyst, then the tissue cyst or bradyzoid in which they are sitting inside a cyst, so they are becoming slow. Tachyzoid, zoid is the sporozoan, tachy means fast multiplying. So tachyzoid is seen in the blood, in the CSF, bradyzoid is seen in the tissues, tissue cyst. Oocyst is released in cat feces which is ingested. All 3 are the infective stages of toxoplasmosis. So, whenever you are eating the raw meat or organ transplant, it can be tissue cyst. Whenever there is blood transfusion or mother to child, congenital transfer, it will happen through blood. So, what is there in blood? The fast multiplying tachy ones. Tachyzoid is the mode of infection. And whenever you are eating contaminated food and water, contaminated with cat litter, you are ingesting sporulated oocyst. But freshly passed is not infective because freshly passed is unsporulated. This is unsporulated. So, infective is what? Infective is what? Sporulated is infected. So, what is not true? Not true. Option A is not true. Right? Most important questions of toxoplasma done. HIV positive patient, white patches in the oral cavity. Who cannot tell me that they are talking about oral thrush or candida? What is likely microscopic appearance of sample from such patches? No points for guessing that it's budding yeast cell with pseudohyphae. Septate hyphae branching at 45-degree angle is given by whom? It's given by Aspergillus, and Aspergillus is definitely not going to cause oral thrush. MNGs, multinucleate giant cells with intranuclear inclusions. What is this? This is herpes simplex virus or varicella zoster virus on Zank smear. No point, no reason of white patches. Acid fast bacilli is TB, nocardia, nothing doing. What else could have been this white patch? It could have been Epstein-Barr virus, but the oral hairy leukoplakia caused by Epstein-Barr virus cannot be scraped off. Why can candida be scraped off? Because it is simply an overgrowth. Just like your candida grows with the creamy pasty colony on SDA agar, similarly it starts growing on the top of your tongue. So you have the overgrowth of candida on your tongue, and simply you get the oral thrush, which can be easily scraped off and seen under the microscope. Now again, see, we are circling back. We are circling back to the topics we had discussed in the beginning of the discussion. We have come on to LX gel precipitation test. Who are we talking about now? We have come back to Corynebacterium diphtheria. We started the discussion with that. Capsular swelling in strep pneumoniae? No. Demonstration is used for the demonstration of which of the following? What do we use the Alex gel precipitation test to demonstrate? We use it to demonstrate the toxin production. The toxin production. Does strep pneumoniae produce any toxin? No. Capsular swelling, what is it? Quellung's reaction. It is Quellung's reaction. Okay, fine. Toxin production by Corynebacterium diphtheria. Yes. Detection of antibodies in syphilis. What is the test? It can be VDRL, it can be RPR, it can be TPHA, it can be FTA, ABS, anything it can be, but it cannot be LX gel. Identification of Clostridium tetani toxin, that is mice inoculation, animal inoculation. So answer becomes toxin production by Corynebacterium diphtheria. They wanted to confuse you between CD and CT. Yes, CD and CT. Single, double dimension. Okay. Names. Fine, I'll tell you. Whenever you are talking about precipitation, there are only 3 tests you have to remember. Only 3 tests you have to remember. LX gel precipitation, name itself is precipitation. Ascolis thermo precipitin. A for Ascolis, A for anthrax, Bacillus anthracis. And slide flocculation. What is slide flocculation? VDRL. These are the only 3 precipitation tests you need to remember. Everything else is agglutination. Everything else is agglutination. What is happening in Ascolis thermoprecipitin? You are taking a test tube. You are taking a test tube. So this is, and you are putting anti-sera and sera, your antigen and anti-sera. They are moving in both the directions, and you get a precipitation band in between. So what is this? Inside a test tube, there is only one dimension. That is the y-axis. Only one dimension, y-axis. So it is one dimension, 2 direction. Okay, one dimension, 2 direction. Because from bottom the anti-sera is going up, from above the antigen is going down. In between they are meeting, forming a band of precipitation. Right? What is happening in LX gel precipitation? This is happening. You have a petri dish. In the petri dish, in which dimension is your anti-sera and toxin moving? This is also 2 dimension, 2 direction, because it will now move in a plane. It will now move in a plane. So what will happen? You have a antitoxin strip. Antitoxin strip, a strip coated in antitoxin. This will release the antitoxin over here in a radial diffusion. Okay. And what is this? This is the strain of C. diphtheria. It will release the toxin from here. They will both meet in the middle and they will form this streak of precipitation is going to get formed. Similarly, from here it is releasing, here it is releasing. It is forming, not forming a spur in the middle, it is coming in contact, it is forming a nice curve. Then we know that this strain A and this strain B are the same strain, because they are leading to the same toxin, antitoxin precipitation line which is being formed, right? And if over here antitoxin was released, toxin was released, this line has been formed, no toxin was released here, so no line has been formed. So I know that the strain 3 is a non-toxigenic strain. This is LX gel precipitation. Rest all names you need not remember for INI or NEET or any competitive exam. Oucher, Octerlony, don't remember. Your wish. I haven't seen them being asked so much. If you want to remember, your wish. Okay, fine. Great. Then what is this? Which of the following acts by the following mechanism of action? Which mechanism of action are they showing? Antigen presenting cell, an APC is presenting the antigen to the T cell. But how is it presenting? From the side. From the side it has gone and activated the V beta region of the T cell receptor. What is this? This is a T cell receptor, right? A T cell receptor. So, normally what happens? This is an antigen. I am the T cell or I am the antigen presenting cell. I am going to show the antigen to the, if my head is the antigen, to the T cell like this. But what will happen? If my finger from the side does only pokes the T cell, what will happen to T cell? It will get irritated. It will blast off. So that is what a super antigen does. From the side, from the V beta region, there is non-specific binding from the side. That is what the super antigen is doing. From the side, it's going and poking the T cell. Then the T cell is getting activated and there is hyper response. That is what is super antigen. So, who produces super antigen? Does Vibrio cholerae act by super antigen? No. It acts by toxin production. Toxin is, so just like E. coli, the GM1 receptor, it breaks the tight junctions. We will come on to that. Strep pyogenes, which one? SPE, strep pyogenes, enterotoxin. Okay, C. difficile. No, they are simply cytotoxins. Toxin A and toxin B, simple cytotoxins. C. botulinum, we have just seen botulinum toxin is what? That is a acetylcholine inhibitor. So, your answer is strep pyogenes. Strep pyogenes. So, you have to remember examples of super antigens. I must have okay, no, I have not shown the table. Fine, no problem. We can remember, we can write and remember. So, what are the ones which are responsible for super antigens? Come on, give me the list. You have Staph aureus. And what of Staph aureus? The toxic shock syndrome toxin, the scalded skin syndrome toxin, the TSST, the SSS, and the enterotoxin for food poisoning. They are all super antigens. What else? Streptococcal pyrogenic exotoxin A and B. They are also super antigens, which is responsible for causing what? What does SPE cause? Chat box. SPE causes what? So, these are the two most important agents that you should know. These are the two most important bacteria that you should know. Okay. Strep pyogenes and Staph aureus. What is strep pyogenes? Group A strep. Group A strep. Right? Fine. 47-year-old farmer presents to outpatient department with complaints of fever. On physical examination, eschar is seen at the bite site. At the bite site. The patient's serum creatinine was 1.6 and platelets were 88,000. Means thrombocytopenia is happening now. Okay. Reduced platelet count. Diagnosis. Scrub typhus. See, leptospirosis is out of question. Brucellosis is out of question. Leptospirosis is what? It is hepatorenal syndrome. It is hepatorenal hemorrhages. It is conjunctival suffusion. It is the rat urine or the sewage worker, etc. Right? Brucellosis is definitely not this. That is the Malta fever or the Mediterranean fever or the typhoid-like illness or the raw milk ingestion. Now, yes, why not B? Now, this eschar can be formed in anthrax and scrub typhus both. So, why not anthrax and why scrub typhus? Because this thrombocytopenia and end organ damage is what you are seeing is more characteristic of scrub typhus rather than anthrax. That is not characteristic of anthrax. So, you have best answer over here is scrub typhus because of thrombocytopenia. And also, why have I focused this bite site? It is your, yes, bite, you're writing. So bite site is kind of giving you the idea that something has bitten. In anthrax, it is simply inoculation because of exposure to animal dander, animal skin, etc. Yes, animal hides, the so-called as hide porters disease, cutaneous anthrax. But what happens in scrub typhus? You have the bite of the chiggerosis, the baby or the larva of the mite. So chigger bite is what is scrub typhus. So all of these are your pointers for scrub typhus. Which of the following diseases is not transmitted by the vector shown? What is this vector shown? First of all, you have to find what is this vector shown. This is a hard tick. A hard tick. So we should be able to differentiate. Let's look at this. This is a tick with the 3 pair of legs and the hard surface. This is a mite. The mite has these thin hair like things on its surface. Okay, you see these hair like structures on the surface? That is a mite. That is a mite. And also for mites larva, the chigger causes scrub typhus. What is this? This is also a tick. And what is this? This is a louse, the refractile louse with the 3 anterior pair of limbs and the long back body with the striations on the body or the segments on the body, and it is refractile and shiny. So you have hard tick, Orientia shushugamushi is by what? Scrub typhus. Scrub typhus is chiggerosis. So it is not your hard tick, it is the larva or chigger. Creman Congo hemorrhagic fever. I always tell you how to remember viral hemorrhagic fevers. You write tick. The vectors for hemorrhagic fevers, you write tick. So from K it is CCHF and from K it is KFD. So these two are the viral hemorrhagic fevers which are caused by the tick. Kaisanur forest disease and CCHF. So this is also tick. Babesia, yes, tick transmitted. Ehrlichia, tick transmitted. So you know all your EAs, Rickettsial, tick transmitted. Ehrlichia, tick transmitted. Babesia, tick transmitted. They are all tick transmitted infections. So only your Orientia shushugamushi, which is scrub typhus, is going to get removed because that is because of the chiggers or chiggerosis. Chiggerosis or the larval stages. Okay, great. 33-year-old sexually active male patient came to OPD with complaints of pain in the genital area. Pain. Okay. On examination, there was painful vesicle associated with painful lymphadenopathy. What is the likely cause? So they are talking about painful genital ulcers with painful lymphadenopathy. How do we remember this? We always write here ulcer. Ulcer can be painless, ulcer can be painful. A painless ulcer can have painless lymph nodes. It can have painful lymph nodes. A painful ulcer usually only has painful lymph nodes. Okay. The prototype disease where both are absent. Syphilis. Then you have dono nahi. Dono nahi means ulcer bhi painful nahi और lymph node bhi nahi. Dono nahi. Donovanosis. Klebsiella granulomatous. Donovanosis. Then सारा फोकस ही lymph node पे है. अल्सर से कोई मतलब ही नहीं. फोकस ही lymph node पे है. लिम्फोग्रैन्युलोमा वेनेरियम नाम में ही है. वेनेरियम मतलब वेनेरियल डिजीज एसटीडी. लिम्फोग्रैन्युलोमा मतलब लिम्फ नोड में ग्रैन्युलोमा बना लिया है. लिम्फोग्रैन्युलोमा वेनेरियम caused by chlamydia, which 3 letter LGV. So chlamydia L1, L2, L3. Not a problem. 1, 2, 3. 1, 2, 3. Done. Then painful. Genital herpes. Genital herpes. How many words? 1, 2. 2 words. So bilateral lesions, bilateral lymph nodes, multiple lymph nodes, painful lymph nodes of both the sides, multiple vesicles on both the sides, bilateral. Then chancroid, oid, O means bubo, painful lymph node, but which is unilateral. Ulcer is also unilateral. Oid means one, O. Single ulcer, single lymph node, but both painful. Bleeds on touch. The sound of D, means bleeds on touch. Chancroid, Haemophilus ducrei, and Donovani, beefy red ulcer, also bleeds. Okay, so ulcer, painless, painful, that is how we remember all the 5 genito-ulcerative diseases. Right. So, painful lymphadenopathy, painful vesicle, what is your diagnosis? Herpes simplex, molluscum, what will molluscum show? Molluscum will show the dimpling, HPV, warts, VZV, chickenpox. So, over here it's quite simple. They are talking about genital herpes and always the below the waist is HSV2. What does molluscum look like? You see this dimpling or the umbilicated dome shaped lesions which can be seen. This is molluscum contagiosum. Molluscum contagiosum virus belongs to the pox viridae or the pox viruses family, right? And what are the inclusion bodies? Henderson-Peterson, HP bodies which can be seen. What is this? Unilateral vesicular rash in a single dermatome. Shingles, varicella zoster virus, VZV, in a single dermatome, reactivation of the virus. So, only the rash will happen in the nerve supplying that particular dermatome, zoster or shingles. What is this? Condylomata acuminata, genital warts by HPV, Condylomata acuminata, right? So, we have seen, correct. 42-year-old person from rural area experiencing CNS symptoms, okay, and vision loss for the past 12 days. The electron microscopic reveals the presence of which organism? So, if you are talking about electron microscopy, that means you are directly putting it under some microscope. Now, they have tried to distract you by saying it's a virus, but then all the 3 they have given are free living amoeba only to you. How to differentiate between Naegleria, Acanthamoeba, Balamuthia? See, vision loss and 12 days. What will happen in Naegleria fowleri? Primary amoebic encephalitis, and it will be death within 7 days. So 12 days ka history to person will not bring only. Acanthamoeba, vision loss, we know that leads to keratitis also. Balamuthia also leads to granular amoebic encephalitis just like Acanthamoeba, but then Acanthamoeba also leads to your keratitis. So that is what they wanted you to figure out, that they are trying to ask you about Acanthamoeba. Vibrio cholerae is gram-negative, comma-shaped bacterium causing cholera. Vibrio cholerae disrupts which extracellular cell adhesion? Oh, come on, this is so easy. Zona occludens. So, zona occludens. Cholera toxin. Cholera toxin acts how? Increases the camp by acting on what? The GM1 ganglioside receptors, just like E. coli. Just that, yes, Quatzot, you are right. Just that you are, just like E. coli, levile toxin. Only difference is that this is highly potent. That is how it causes the disease. Which of the following viruses need reverse transcription for PCR? So, they want to ask you which is an RNA virus. EBV, it is human herpes. What? Simple, very easy chicken. Mnemonic for human herpes viruses: simple, very easy chicken. Simple, human herpes 1, simple, herpes simplex 1, simple, herpes simplex 2, varicella zoster, human herpes 3, easy, Epstein-Barr virus, human herpes 4, chicken, cytomegalovirus, human herpes 5. So, this is HHV4, CMV, chicken, HHV5. We know all 3 adeno, these are what? These are double-stranded DNA viruses. So, these are all double-stranded DNA viruses. We have just seen happy we have seen. So, the only one left is respiratory syncytial virus. It belongs to what? It belongs to the Paramyxoviridae family. Paramyxoviridae family. And we know that who all are part of Paramyxoviridae family? MMRH. MMRH. Measles, mumps, not rubella, RSV, and Hanta, Nipah, all of those. Right? Oh, Hendra, Nipah, the bat transmitted ones. 23-year-old male presents with 3-day history of fever. CBC shows platelet count less than 90,000. For a suspicion of dengue, which of the following cannot be done on day 3 of infection? PCR can be done. Yes, it can be done. Of course, we can find out the virus. NS1 antigen can be done on day 3. Yes, antigen will be there in the first 3 days most likely. IgM ELISA, I don't think so. It will start rising after day 5 only. Xenodiagnosis using culture in Aedes mosquito. See, whenever there is a virus, of course, it will grow in culture also. So, the only option is IgM ELISA because that can only be done after day 5 of infection of dengue. HIV virus that attacks the body's immune system. HIV genome needs which of the following to enter the membrane? Come on, answer this. Buzzword is enter the membrane. All of these are the receptors. All of these are important receptors. What does it use to enter the membrane? So imagine I am the HIV virus and I have a T cell in front of me. This is GP120. My head is GP120. I am going to give the GP120 to T helper, the CD4 cell. Then I need co-receptors from the side to bind. What are the co-receptors? CCR5 or CXCR4. How to remember? What if they had written here CCR4 and CXCR5? Then it would have been a total confusion. Then how to remember that it is not this? Chai cigarette, 5 rupees. Chai cigarette, 5 rupees. CCR5. So obviously then the CXCR is 4. Then what happens for complete binding? GP120 binds CXCR5, CCR5 co-stimulators. Then from behind the GP41 comes and pulls the T cell and the membranes fuse. So when the cell membranes have to fuse, you need GP41. So for entry inside the cell membrane, it is GP41. Okay. 35-year-old female patient recovered from COVID-19, given steroids, 3 weeks, image of the fungus. I mean, this is so simple. Given steroids itself, you know that they're talking about mucor. But why do you think they're talking about mucor? Because if you zoom in, you can see the broad aseptate ribbon-like hyphae. The broad aseptate ribbon-like hyphae you can see. Right? Broad aseptate ribbon-like hyphae. Mucor. What is aspergillus? Septate hyphae. Dichotomous branching, acute angle branching. Okay. Yeah, it's FMG PYQ, it's NEET PYQ, it's God knows what not, it's every PYQ. Candida is budding yeast cell and trichosporon. What is the difference? So let's look at these images. What is this? This is the hyaline thin septate hyphae with the dichotomous or the acute angle branching. Okay. What is this? This is the budding yeast cell with the pseudo hyphae. What is a pseudo hyphae? This is a single yeast cell. The daughter cell came but failed to detach. So now the daughter cells are just forming on top of the mother cell. That is pseudo hyphae for you. What is trichosporon? It is a yeast cell which is rectangular. So while we know that yeast is oval like this, a rectangular yeast cell is trichosporon. So sometimes trichosporon is confused as hyphae, but it is in fact a yeast cell which is rectangular in shape. Which bacterial toxin acts by interfering with EF2 function? You have all talked about it. Diphtheria. Corynebacterium diphtheria. ADP ribosylation, elongation factor 2, inhibition of protein synthesis. Okay, great. Which of the following is there are advantages of saline mount? compared to iodine mount. When we put iodine mount, we are able to see the internal structures of the cyst very, very nicely. But what happens? We end up killing the trophozoites. So motility of trophozoites is better appreciated in normal saline? Of course. Internal structure of cyst? No. That is with iodine mount. Differentiate bile stain versus non-bile stain? Of course. Because when the eggs, they pass through the intestine and they get stained with the bile, they turn brown themselves. And iodine is also brown. So in an iodine mount, the bile staining is not much appreciated. So that bile staining is appreciated in normal saline. So your answer is 1 and 3. So option B becomes correct. So this brings us to the mnemonic Neha. Your non-bile stained eggs. Rest all are your bile stained eggs. Okay, Neha. Nicator americanus, hookworm. Nicator americanus, hookworm. Enterobius vermicularis. From everywhere this guy comes in. In every mnemonic this guy comes in. H. nana. And Ankylostoma duodenale, that is also hookworm. So actually just 3, hookworm, enterobius and H. nana, but we remember Neha. Okay, Neha. Identify the organism and staining. Oh, not even a problem. What is this? This is an acid-fast bacillus. Long bacillus, thin filamentous branching bacillus. What is this? Nocardia and acid-fast stain. No doubt about it only. This is not Streptococcus and Gram stain. This is not Cryptococcus and India ink. This is not coccidiomycosis and pus stain. What will you see in coccidiomycosis and pus stain? You will see the spherules and the party. What will happen in the coolest party? The hot boy will ghost you, na? So ghost cells are seen in coccidiomycosis. 55-year-old HIV patient with white patch on the tongue or buccal mucosa cannot be removed on rubbing. We have just discussed this. Epstein-Barr virus leading to oral hairy leukoplakia. Oral hairy leukoplakia. Yes? No problem. Which organism shows movement transcellular by actin filaments? Actin filaments. Very, very specific. Yes. Listeria monocytogenes. Salmonella is secretion systems. Type 3 secretion systems. Enteroinvasive E. coli is not actin polymerization. It is only Listeria. So what happens? Listeria monocytogenes adheres, comes inside, forms a vacuole, escapes the vacuole, leads to actin polymerization and propulsion of the cell itself. So basically the cell it has infected, it becomes a glove in hand. It tells the cell itself to protrude and then enter inside the other cell, and that is how they move from cell to cell through actin polymerization of the cell that they have infected. It is Listeria monocytogenes. Very, very specific characteristic. Okay. If I ask you a question here, rolling mechanism of phagocytosis. Rolling mechanism of phagocytosis. What is that? Who shows the rolling mechanism of phagocytosis? So normally a phagocytic cell, how is it going to ingest a bacterial cell? Like this. But what happens? Rolling. If this is a macrophage, the arm comes and rolls around the antigen like this. This rolling is seen by Legionella. Legionella pneumophila. Potential question. Potential question. Okay. Legionella pneumophila. Okay. Principle of Bohr-Paul-Bunnell test of EBV. Cell-mediated hypersensitivity? No. What is that? That is type 4 hypersensitivity. Is it not? That is type 4 hypersensitivity. Immune complex mediated is type 3 hypersensitivity. Heterophile antibody. Yes. Heterophile antibody. So how do we remember heterophile antibodies? Our mnemonic is cold peanut butter PB sandwiches on Wednesdays and Fridays. Cold PB sandwiches on Wednesdays and Fridays. So these are all your heterophile antibody detection tests. heterophile antibody detection tests. How do we remember? Cold means cat, cold agglutination test. Cat sat on a mat with my brotherly. So my is mycoplasma. PB is for EB. So Paul Bunnell is for Epstein-Barr virus. PB is for EB. PB is for EB. Paul Bunnell. What about Wednesday, Friday? Wheel-Felix. Wheel-Felix reaction. And what is the mnemonic for Wheel-Felix reaction? Okay, Mira. Scrub. Okay, Mira. Scrub. So, ox K is Proteus mirabilis shown by scrub typhus. Ox K, Proteus mirabilis and scrub typhus. Rest all OX2 and OX19 by other Rickettsial group. OX2 and OX19 other Rickettsial group, where OX2 is the Rick spotted tick. Rickettsial, Rickettsii. Okay, so these are the mnemonics for heterophile antibody detection test. 17-year-old girl manifested with fever and retroorbital headache for tourniquet test and NS1 are positive. Which of the following comes under the severe criteria? Now, as promised, we are going to discuss about the different criteria for diagnosis of dengue infection, right? So, let's look here. It is dengue with a, this is just simply dengue fever. This is dengue fever with warning signs, and this is now severe dengue. What happens in dengue? Simple tourniquet test and vomiting, nausea, vomiting and rash comes under your dengue only, okay? What comes in? Warning signs. It is the abdominal tenderness, the abdominal pain, persistent vomiting and liver enlargement is what comes. And increased hematocrit and everything comes under warning sign of dengue. What is severe dengue? Severe dengue is toxic shock syndrome. Now there should be plasma leakage and organ involvement. So now when you see deranged liver profile, impaired consciousness, severe bleeding and fluid accumulation and respiratory distress. So respiratory distress and liver dysfunction. Then you talk about severe. So they are asking about severe criteria. So leukopenia plus thrombocytopenia is simply your dengue. Then persistent vomiting is a danger sign. Hepatomegaly is a danger sign. AST and ALT more than 1000 become your severe dengue. Okay, these are with warning sign. This is simply dengue fever without warning sign. This is with warning sign, and this becomes your severe dengue. So option D is your severe dengue, right? Which is the, what is the microscopy technique to produce high contrast image of transparent live bacteria? Come on. Best contrast is achieved by which of the following? Best contrast image. Electron microscopy? No. Definitely not a best contrast image. Very black sketchy images. Dark field microscopy? No. Dark field microscopy, they want to confuse you by transparent live bacteria. But it is simply putting a patch stop in the pathway and simply creating a spotlight effect. Phase contrast microscopy gives you the best contrast, high contrast without having to put any stain on your bacteria. So without having to put any stain on your bacteria, these two are going to be your methods of providing best contrast. Okay, great. Antigen binding to MHC class 1. Activate which cells? So I always tell you the mnemonic. There is one mnemonic for all immunology. 1 2 ka 4, 4 2 ka 1. My name is Lakhan. My name is Lakhan. So 1 2 ka 4 applies to all hypersensitivity reactions, applies to all T helper cell and receptors and interleukins, entire microbiology. So if you have a T helper cell here and if you have a cytotoxic T cell over here, so this is a CD4 receptor and this is a CD8 receptor. So if it is 1 2 ka 4, then which MHC is going to come here? And which MHC is going to come here? 1 2 का 4, सो 2 का 4, 2 के बाद आ रहा है 4, तो CD4 से कौन बाइंड करेगा? MHC2, MHC2 बाइंड करेगा CD4 से, एंटी हेल्पर का H itself looks like 4, so you can remember that it is CD4. So what will bind to CD8? MHC1. So MHC1 is going to bind to your cytotoxic T cells. Okay, cytotoxic T cells. Amazing. Which agents can be used as disinfectant but not as sanitizer? Disinfectant but not a sanitizer? Come on. What is a disinfectant and what is a sanitizer? Hydrogen peroxide is a high level disinfectant. If you use it at more than 6%, it can also be used as a sterilant. Where do we use this sterilant? That is, it starts killing spores now. That is plasma sterilizer. Remember? Plasma sterilizer. Plasma sterilizer. Penicillin, no, that is just an antibiotic. That is just an antibiotic. So it can be used as a sanitizer. It can be put on your living tissues. So sanitizer can be put on your hands, etc. Then methylparaben can also be put. Bleaching powder can also be put. So can be used as a disinfectant but not as a sanitizer is your hydrogen peroxide. You can definitely not use it as your hydrogen peroxide can definitely not be used as a sanitizer. Okay, chalo. Which virus can be identified by a PCR method and is endemic to India? PCR method, all of these can be detected by PCR method, okay, not a problem, they are all viruses, but it is endemic to India. Is yellow fever there in India? Not at all, nowhere in India. Where is it found? It is found in the African regions, And which strain of vaccine you are required to take to travel to India from Africa? 17D strain of the vaccine. Ebola, is it there in India? No, it is near in the Sudan and Congo. Congo near the Ebola river of Zaire. Till date, no case of Ebola. West Nile, yes, West Nile virus is there in India. What about Hendra, Nipah? These are the bat transmitted viruses. Hendra has not been able to enter, but what has entered in Kerala? Nipah has entered in Kerala. So what is endemic to India? It is the West Nile encephalitis virus. West Nile encephalitis virus. And what does West Nile encephalitis belong to? It belongs to the Flaviviridae. And we know Flaviviridae are the yellow fever group of viruses. Yes, yellow fever group of viruses. And amongst the Flaviviridae, all are mosquito transmitted except tick, K for KFD. Yes, so this is going to be Aedes aegypti. Aedes aegypti. Aedes aegypti. Just random facts throwing your way. If you have to talk about flaviviruses, Flaviviridae, then I always tell you to remember the flavorful lemon. Lemon is yellow. Flavi means yellow. So these are the yellow fever group of viruses. So what is your mnemonic? Yellow West Kid is DJ. Yellow West Kid is DJ. So you have yellow fever, West Nile encephalitis virus, Kaisanur forest disease, Zika virus, dengue and Japanese encephalitis. Except KFD, it is the tick-borne one. Rest all are Aedes aegypti. Yes, there will be an INICET marathon. Rest all will be Aedes aegypti. Aedes aegypti. Okay? Great. Which of the following viruses exhibit genetic reassortment? Similar to influenza virus. So you simply have to pick up your influenza virus. What is this? Segmented RNA. Segmented RNA with the 8 segments. Then hemagglutinin and neuraminidase. This itself looks to me like influenza virus or orthomyxoviridae. So answer is of course A, because we know that the genetic reassortment, which is called as the genetic shift, and shift is sudden and less frequent. Something which is sudden will be less frequent, something which is gradual will be more frequent. So genetic shift is genetic reassortment is sudden and less frequent, whereas genetic drift is gradual and more common. What happens in shift? Completely genetic reassortment means bhelpuri, reassortment of the genes. So 1, 2, 3 viruses come from different directions, completely reassort and form a completely new strain of virus. That is genetic shift. So a completely new strain of virus is created in genetic reassortment. What is this? This is the spaceship looking guy. Spaceship. And so of course spaceship is adenovirus. Adenovirus. This is the bowl of spaghetti. Bowl of spaghetti. Filamentous, filovirus. Spaghetti is filamentous, filoviruses. Ebola and Marburg. Ebola and Marburg. These are viruses with very, very high fatality. मार देते हैं, so Marburg. Then what is this? The bullet shaped. Bullet shaped. The rhabdoviridae. Rhabdoviruses. So of course one is the rabies, and I always tell you to remember the silver bullets. Silver bullets. So you have Chandipura. 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 Okay, Chandipura. Silver bullets. Alright, match the following eggs. What is happening here? You see the radial striations. Radial striations. And you see the hexacanth embryo inside. Hexacanth, because you can see the 1, 2, 3 hooks of the larva. Hexacanth embryo. What is this? This is tinea. This is tinea. Where is tinea? 1D. Where is 1D? Here is 1D. What is this? Polar filaments, polar thickenings, hexacanth embryo, non-bile stained, H. nana, of course H. nana. This is also a cestode egg. 2A, this is also 2A. What is this? Blastomeres. Blastomeres are there. Again, this is also non-bile stained. See, this one is bile stained because it is brown. This one is non-bile stained. This is also non-bile stained. This is also non-bile stained. This is hookworm. So 3 is C. So this one should be it. And then finally, you have the fertilized and the unfertilized and the fertilized egg of Ascaris. Ascaris is roundworm. Ascaris lumbricoid. So 4 is B. So of course your answer becomes B. Okay? Answer becomes B. Which technique uses RNA? Very, very famous mnemonic. North is for roti, south is for dosa, and west is for pizza or protein. Yes. So Sanger's is simply gene sequencing. It's a type of a gene sequencing. It is gene sequencing. It can use anything. Reverse transcriptase PCR uses RNA, of course. Western blot, protein. Southern blot, DNA. So had they given northern blot, then it could have worked. But reverse transcriptase PCR or northern blot, anything if they had asked, it could have been RNA. Okay. A woman presented with complaints of greenish discharge on examination had strawberry cervix, DOC of infection. So what is the drug of choice for Trichomonas vaginalis? Come on. Trichomonas vaginalis, metronidazole. Acyclovir you will give for what? Herpes simplex. Herpes simplex. All human herpes, 1. Letter A, it is acyclovir. Fluconazole you will give for what? Candida. So vaginal candidiasis. Ceftriaxone you will give for what? Neisseria gonorrhoeae. Neisseria gonorrhoeae. Okay. Which of the following is a dematicious black fungus? So how have they tried to confuse you? By saying Aspergillus niger. Now please understand, even if niger, it is Aspergillus, and all Aspergillus is hyaline hyphae. Hyaline septate hyphae. What is the meaning of hyaline? Hyaline means colorless, colorless. So it cannot be demititious black fungus. Mucor, misnomer. Black fungus of mucor is a misnomer because it produces a black lesion. Black lesion. The hyphae itself are hyaline. Hyaline. Broad aseptate. Cladophyllophora, Phyllophora, Fonseca, Alternaria, Bipolaris, Curvularia, whatever you hear, demititious. Blastomyces, figure of 8 appearance, broad-based budding, yeast cell, not even a mold. It is an yeast cell. So your only option is Cladophyllophora. Okay. Match the organism with a drug which is intrinsically resistant. By birth it is resistant. Candida krusei fluconazole. Looks to me like it could be it. Let's look further. Aspergillus niger voriconazole. Voriconazole is the drug of choice for Aspergillus. So that is definitely not it. Aspergillus fumigatus and micafungin. Micafungin is actually an echinocandin. And who are completely resistant to echinocandins? It is trichosporon. So if they had written trichosporon here, then it would have been a good option. Trichosporon is intrinsically resistant to echinocandins. Histoplasmosis amphobi? No. If they had written Aspergillus terreus, the little Aspergillus, the smallest Aspergillus, that is resistant to amphotericin B. So, of course, Candida krusei and fluconazole are resistant. So, you can remember krusei is cruel. Cruel is, cruel. So, it is so cruel that it is resistant to fluconazole. Okay. True regarding trematodes. Only one is true. Triclabendazole is used for all species. Okay, I don't know. Fasciola hepatica acquired through ingestion of contaminated aquatic plants. Yes, this seems true because I have always said fasciola means fresh plants. Fresh aquatic plants. Always I say this. So, F is F. This seems true to me. Schistosoma hematobium is monoecious. Is it monoecious? No. What is schistosoma? Sexes are separate, right? So, let's talk about schistosoma. So, let's talk about all trematodes. And let's talk about schistosomes. So, let's write. Schistosomes. Okay, all trematodes versus schistosomes. So, for all trematodes, there the 5 larval stages. My red cat meows. Myra Cedium. Radia. Sarcaria. My silly red cat. Silly is sporocyst. Sporocyst. And meows, metacercaria. Metacercaria. So, for all trematodes, infective stage is metacercaria. And what is the mode of infection? Ingestion of this metacercaria. Ingestion of this metacercaria. But what about schistosomes? All exceptions are with S only. Skin penetration, no ingestion. And skin penetration by whom? Cercaria larva. So, there is no metacercaria larva only for schistosomes. Right? S. S2. Two sexes. Two sexes means sexes are separate. So, all trematodes are monoecious. but schistosomes are dioecious. There are two sexes or sexes are separate. SO, snail only. Snail only means what? There is only one intermediate host. Only one intermediate host is there. They all have two intermediate hosts. Two intermediate hosts. It can either be fresh aquatic plants or fish. Yes, and all the F's, Fasciolopsis busci, Fasciola hepatica, they are all freshwater plants. Restor, Clonorchis, Opisthodorchis, they are all fish. Okay, they are all fish. Then S and S. So they have a slit-like body. Slit-like body means all trematodes have a leaf-like body. They have a leaf-like body, but schistosomes have a slit-like body. And what is the last S? Spine. Spine is there in the eggs. Spine is there in the eggs. All trematodes have operculated eggs. Operculated eggs. Whereas schistosomes don't have operculated eggs. They have spine in the eggs. So that is the difference between all trematodes and schistosomes. So this is not, praziquantel is the drug of choice. Fasciola hepatica, fresh plant seems correct. Schistosome monoecious, no, sexes are separate. Fasciolopsis busci, infection writes in hepatic radicals. No, not radicals. So your answer is hepatica, infection acquired through ingestion of contaminated aquatic plants. Okay. Okay. Male traveler presents below with bone marrow smear. The moment you hear bone marrow, first sample of choice spleen, second sample of choice bone marrow. We are talking about the massive spleen disease with the large hepatosplenomegaly, the Kala Azar. Kala Azar. Why? Because over here you see what? You see the LD bodies, Leishman-Donovan bodies. What do you see in them? You see a small little kinetoplast and a nucleus. This is the amastigote form of Leishmania, which you are seeing as LD bodies, right? So you have the LD bodies and the Donovan bodies, right? LD body is seen in Leishmaniasis or Kala Azar. Or Kala Azar. What is it? This is a macrophage and you have nucleus kinetoplast, nucleus kinetoplast, nucleus kinetoplast. What is this? This is the amastigote form of Leishmania. Amastigote. Mastigote means flagella, amastigote means without flagella. Donovan bodies is in donovanosis. Klebsiella granulomatous can be very high yield. So, safety pin appearance. Here you have a macrophage and you have these cocobacilli with the safety pin appearance intracellular. That is your Donovan bodies seen in donovanosis or Klebsiella granulomatous. The bipolar safety pin appearance cocobacilli. Of Klebsiella granulomatous. Right? Oocysts of organisms are found in which of the following layers on formalin ether sedimentation technique? Oocyst kahan honge? Bottom, the heaviest is sediment is going to be the oocysts. Formal ether, okay, formalin ether. So bottom is oocysts, in the middle is formalin, then plug of debris, just fecal matter, and the lightest being the ether is going to be on the top. So you have ether, debris, formalin, and at the bottom is the heaviest, oocysts. Quite simple question. 46-year-old man presents to outpatient department with a complaint of flu-like symptoms, headache and maculopapular rash from trunk to extremities. On physical examination, eschar formation at the site of mite attachment and lymphadenopathy. The patient was accidentally infected by the six-legged larvae. Life cycle of the organism is given below. So what is the mite? What is the mite? What is causing it? This seems like, so you can see the life cycle, the six-legged larva which normally feeds on rodents, is biting. So it is Orientia shushuga mushi, which is the scrub typhus. Yes, trombiculid mite. Trombiculid mite. Good, 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 good. Which of the following intermediate host of parasites is correctly matched? Diphtheria, cyclops or crustaceans? This looks fine to me. Let's look more. Paragonimus sheep? No. Paragonimus is fish. Brugia fish? No. Actually, crayfish should be here. Brugia malei is Mansonia. And what about Fasciola? F for freshwater plants. So, A is correctly matched. F should be fresh aquatic plants. Okay. Which of the following are right about chancroid? I have always told you oid. Oid means one. One means unilateral bubo. Unilateral painful ulcer. If you remember what we had drawn a while back. Painful, painful, chancroid, bubo unilateral, bleeds on touch, right? Chancroid caused by Haemophilus ducrei, H. ducrei. So it is saying painful ulcer, correct. Bleeds on touch, bleeds on touch, correct. Groove sign was there in lymphogranuloma venereum, which was forming the granulomatous lymph nodes. It was like two granulomatous lymph nodes enlarged, so in between them there is a valley or a groove which has come up. School of fish appearance, like all of you were saying, school of fish is seen in whom? Stream of fish is seen on whom? So stream of fish is Vibrio, and school of fish or railroad or tram track, everything is H. ducrei. So it is 1, 2 and 4. 1, 2 and 4. Correct. Answer is B. Identify the phenomenon. What is this? Staph aureus. Staph aureus is releasing factor X and factor V. So you see the colonies forming close to it. This is satellitism shown by H. influenzae. Satellism is by H. influenzae, not by Staph aureus. Staph aureus is what provides factor X and V. Beta hemolysis, of course, Staph aureus is showing the beta hemolysis. But what is important to see here is the satellitism. Then what is camp test? This is camp test. In between, if you put a streak of Staph aureus, in between, then the zone of beta hemolysis gets enhanced. Enhanced zone of beta hemolysis. Why? Why the enhanced zone of beta hemolysis? It is only shown by which? So how to remember? What is the mnemonic? The mnemonic is boot camp. Boot camp and abs. Abs. So group A is bacitracin sensitive and group B is camp positive, right? So this enhanced zone of beta hemolysis will be shown by group B. So group B is strep A galacti and this will be group A or strep pyogenes. Then you get confused about reverse camp. Reverse camp. P for, come on, tell me. This is shown by Clostridium perfringens. Clostridium perfringens. Not Corynebacterium diphtheria, Clostridium perfringens. Reverse camp. Yes, correct, correct. Okay. The cell wall depicted most likely belongs to what? You can see the beta-1,3 glucan synthase. You can see the chitin. You can see the ergosterol. You can see, most importantly, the beta-1,3 glucan. And so it could have been Candida, but have they written Candida? No. Now it also should have Galactomannan. So it looks like a fungal cell wall to me. So Aspergillus fumigatus. Mycobacterium TB? No. It will have mycolic acid and arabinomannan. Arabinomannan. Mycoplasma will have 3 layers of cell membrane. It does not have a cell wall only. There is no cell wall. 3 layers of cell membrane itself with sterols and no cell wall. No cell wall. Rhinosporidium, again no, not able to grow, and no 1,3 beta glucan. So you have Aspergillus fumigatus. This looks like a Aspergillus or a fungal cell wall. Okay. Patient had a warty lesion after a wood prick. So whenever it's wood prick, it's either sporotrichosis or it's chromoblastomycosis or it is mycetoma. From the image given below, so what are these black bodies? Sclerotic bodies or medullary bodies or muriform bodies or copper penny. Copper penny. Copper penny bodies shown by chromoblastomycosis. Chromoblastomycosis. What is the characteristic lesion of chromoblastomycosis or sclerotic bodies? It is the verrucous lesions, the tumor-like lesions. Okay, verrucous lesions or tumor-like lesions. Non-capsulated yeast means nothing. Capsulated yeast means cryptococcus. So that is definitely not one of the causes of these black or copper penny or the medullary bodies. Sporotrichosis will show you asteroid bodies. So whenever there is thorn prick, it is either sclerotic bodies, which we have just learned. It is either asteroid bodies, and then we are talking about sporotrichosis, or it is mycetoma. So mycetoma will have the black granules and the discharging sinuses, right? Always. Deficiency of the following components leads infection, complement system associated with infection by Neisseria meningitidis. Disseminated invasive gonococcus, C5 to C9 deficiency. Also a NEET PG repeat, okay, repeatedly asked question. Match the disease with etiological agent. Simple now for me. Donovanosis is actually Klebsiella granulomatous. I know this by now. Then rat bite fever, Streptobacillus mollifiormis, or it can be Spirillum minus. Spirillum minus. All are rat bite. Pinta, yaws, endemic syphilis, these are all agents of treponema. So Pinta is Treponema keratium, and Oroya fever, also called as Carrion's disease, is Bartonella bacilliformis, which is angiomatosis kind of a disease. So 1B, 2A, 3D, 1B, 2A, 3D and 4C. This is it. So we talk about Bartonella. Bacilliformis is Oroya fever or Carrion's disease. Quintana is trench fever. And then you can forget all of these. Simply remember Hensley and cat scratch disease. These are the 3 important Bartonella you have to remember. Bacilliformis, Oroya fever, Quintana, trench fever, Hensley, cat scratch disease. Potential question because Bartonellosis is diagnosed at AIIMS Delhi. So they might ask it in INICET. What about the treponema? The treponema, your endemicum will cause endemic syphilis or Bigel. Pertuni is yaws and keratium is Pinta. Okay, this is important about treponema. What about other spirochetes? Borrelia recurrentis, epidemic relapsing fever, you know this. Bugdophyry is for the baby singer, Lyme disease, BB, Bugdophyry, Justin Bieber, got Lyme disease when his face got paralyzed and he got ptosis, right? And leptospirosis, of course, leptospirosis. So this you have to remember. Palladium endemicum, endemic syphilis, Palladium pertunios, and Keratium is pinta. Pinta. Which of the following when administered to a patient does not impart passive immunity? Does not impart passive immunity. So basically they are talking about active immunity. If you give an antibody, passive immunity you are giving. If you give IgA, it's an antibody, again passive immunity you are giving. If you give antitoxin, that is also a type of an antibody, again passive immunity you are giving. So toxoid, when you give the weakened toxin, the body has to produce antibodies. So toxoid is the answer for active immunity. This was all important questions, many PYQs we have discussed today. Try to incorporate related questions along with these questions, but we are going to have an INICET marathon very soon where all of these mnemonics and everything more and more I will tell you. So stay tuned for that. Thank you so much for such good participation. Hope you enjoyed the session. Thank you guys. Any doubts, you can ping me on Micro Boosters, Dr. Anusha Rathi. I am there. Thank you, Nelson. I am there on Instagram as well as Telegram. You can definitely ping me over there. Thank you guys.